Bore da, good morning everybody. Croeso I bawb. Welcome to the meeting. Just a few preliminary points. Members of the public are welcome to observe the proceedings and will be given the opportunity to be involved at the end of the meeting, the formal meeting, because we have a listening to you agenda item at the very end. In terms of using these, some of you may not be familiar with them. You press the red button when you want to speak and be careful to turn it off when you've finished. I'm allowed to leave mine on all the time, so please don't shriek at me when you see mine on. So we will be recording this meeting and placing the proceedings on the internet at the end for people to be able to hear the discussions. Unfortunately, we're not able to webcast today. The technology isn't available. We have a member of staff in the room, I think, who will be able to assist you with any queries you may have during the meeting. And if you need any help, please put up your hand and someone will come to you. I'm not sure what sort of queries you will have. But, the board papers, we have copies. Does everybody have a copy of the papers? If not, we have some spares. Right, thank you. Welsh translation facilities are available, accessed via the headset. I gather the Delith is in a booth at the back there. Oh, welcome, Rosemary. No, not at all. It's your room. It's your room. Yeah. Yes, Delith is in a booth at the back, and we will be testing the headsets to ensure that they work. So if you would please now test them. Could you please assist us, Delith, at this point? No.
Yes.
I can't.
No, I can't.
Am I doing something wrong?
Press the headphone button.
Oh, okay, right. Yeah, okay, thank you. I've not used these in... Yes, yeah, okay. Thanks, right. Thank you very much, Delith. Fire exit notices are displayed. We're not expecting any fire drills today, so if a fire alarm sounds, please act immediately, leave the room. So those preliminaries being completed, could we just carry on with the rest of the meeting? First of all, just on this table, would people on the table here just go around and introduce themselves very quickly so we all know who you are? Just briefly, I'm Viv Harpwood. I shouldn't really be going first, I should be going last, but I'm Viv Harpwood, I'm the chair of Powys, and I've just taken over from Bernie Rees, chair of Hywel Dda. I'm delighted to hear she's doing well, and of course very sorry to see her go, but she's fine. I was a bit surprised I was going to have to take over a bit later, so please bear with me today if I'm not quite on the ball. Rosemary, would you like to start going round?
Thank you. Thank you, Madam Chairman. You will have all seen me come in. I'm the leader of Powys County Council, and I'm very sorry I was late. I've got a good excuse. We've got an Estin inspection happening today. Right.
Caris James, Statutory Director, Social Services Ceredigion.
Elen Ogwen, Arweinydd Cyngor Sir Ceredigion.
Hi, I'm Jack Evershed. I'm Chair of the Public Patient Forum and Rural Health and Care Wales.
Good morning. I'm Steve Moore. I'm the Chief Executive of Hywel Dda Health Board and also now taking back the reins of the Lead Chief Exec for the Mid Wales Joint Committee.
Good morning, Peter Skit. I'm the Programme Director for the Mid Wales Joint Committee.
Bore da, Hayley Thomas, Cyfarwyddwr Cynllunio Perfformiad I Bwrdd Iechyd a Dysgu Powys.
Bore da, good morning. I'm Annie Bullman. I'm the Corporate Director for Children and Adults in Powys County Council and the Statutory Director for Social Services.
Bore da, Morwenna Edwards, Cyngor Gwynedd, Cyfarwyddwr Corfforaethol.
I'm Joy Baker. I'm from North Wales Community Health Council.
Hello, I'm Gabrielle Heathcote and I'm from Ceredigion Community Health Council.
Borida, I'm Andrea Blaney from Powys Community Health Council, standing in for Francis Hunt, who sends her apologies.
Thank you. Diolch yn fawr. We do have some apologies here. Wyn Parry from Powys, the Medical Director. Carol Shillibeer, Chief Executive of Powys Teaching Health Board. Jason Killins, Chief Executive of the Welsh Ambulance Service Trust. Sue Danbrook, Director of Care Protection and Lifestyle Services, Ceredigion. Francis Hunt, Chair of Powys Community Health Council. Katie Blackburn, Chief Executive, and thank you for attending, Andrea, in their place. Gary Doherty, Chief Executive of Betsy Cadwallader University Health Board. Unfortunately, there is no one from the Health Board, Betsy, able to attend today unless somebody has popped up from somewhere, because there's a clash with interviews and stakeholder sessions being held for a Betsy director post. You may have thought that Samir Said Edwards was attending from Welsh Government. She is not able to attend, unfortunately. She's just let us know. So I don't think there's anyone from Welsh Government here. Is that correct? Right. Right, thank you very much. Report from the lead chair. There is a written report which has been submitted. As I explained, this is my first meeting as lead chair for the Mid Wales Joint Committee. I'm not going to read this out because you've got it in front of you to read if you want to, and happy to answer any questions at the end if members of the public are here. Otherwise, I could deal with any issues during the meeting. You'll see that there are a number of national developments outlined, particular focus on a healthier Wales, which is currently in the process of being implemented. And we see that, you will see, I'm sure, that there are a number of, as the meeting goes on, a number of items relating to funding there. We'll be having a presentation on Powys, the Powys Regional Partnership Board, known as the North Powys Wellbeing Programme, and the West Wales Regional Partnership Board. Well, not a presentation, an outline of what's going on. A lot of work going on in public service boards. Evidence has already been gathered by Welsh Government about the whole interrelationship between various regional boards, regional partnership boards, public service boards, and so on. National events have been held in March. There was a regional event more recently in June, beginning of June, and the idea is to share ideas about where there are overlaps, similarities, and so on, about what's going on. A more detailed report summarising the outputs from that event will be shared as soon as it's available with members of this committee. Rural Health and Care Wales, we have somebody here from that. That's progressing. The Mid Wales Joint Scrutiny Working Group will meet later, I gather, yes, this afternoon. And various leadership roles have changed, as we explained at the start. I've taken over from Bernie Rees, and Steve has taken over from Carol Shillibeer. But there's been no change in some of the key posts, and work is continuing there. We have Hayley here today, who will be speaking a bit later. The Mid Wales Public and Patient Engagement and Involvement Forum, there's information about that there. Jack Evershed, welcome Jack, has been reappointed until March 2020. If there's anything else anyone would like to raise in relation to this Chair's report, I'd be happy to deal with it.
Jyst eisiau codi a diolch o galon am yr adroddiad yma'n gynhwysfawr iawn, ond sylwi bod gynnon ni wybodaeth am yr Cymru iachach o ran y gorllewin a hefyd o ran be mae Powys yn neud. Ac wrth gwrs o Gwynedd dwi, so da ni'n rhan o'r un Gogledd Cymru. Wedyn, fedra i rannu efo Peter gwybodaeth am hwnnw, achos mae gynnon ni ddipyn o bethau'n digwydd yn De Meirionnydd, fysa'n bwysig, dwi'n meddwl, I bartneriaid ymwybodol ar. Dyna'n iawn.
Yes, thank you. Yes, certainly. Yes, thank you. Gabrielle.
I noticed in your report, and this is a phrase which reoccurs in Steve's report, a reference right at the end under key events to agree a refreshed approach to its future arrangements. And I wondered what that actually meant, and whether that's going to become apparent as the meeting proceeds, or whether Steve is going to enlighten us when he gives his report.
Yes.
But I saw that phrase occurred a number of times. That wasn't really unpacked.
No. Steve and I have had a discussion about this, and of course we'd be very happy to take advice from people in the room. Steve, do you want to elaborate on that?
Yeah, thanks. Nice to see you, Gabrielle. It's been a while. I think first thing to say is, when you get a new chief exec and a chair, there is just an opportunity to look at things. There's nothing to read into that, actually. I think it's just about how we can best do business, how we can ensure that we get the pace that I think we all want around some of these things, whilst also being very open. I think that's one of the hallmarks that we've had both for this joint committee and more generally. So I think at this stage we've got no firm ideas. I think what we're going to want to do is talk to all of our partners about what works, what doesn't, how we can take it forward. We've got to keep things fresh. I think that's the only purpose of this. So we'll be out talking to you and others about what that might look like.
Turn your speaker off.
Are you happy with that, Gabrielle? As Steve said, there's no hidden agenda there. It's just that we were new to it, and new to the sort of leadership roles, and just looking for a way forward, really.
Yes. I just wondered about the RE bit of fresh. Refresh.
Oh, I see. Yes. Okay. Yeah. Do you want to take that?
I think just as I said, I think there is an opportunity to refresh what we're doing. That's all it means. So actually, it's about how we want to work together going forward, so that we can keep the agenda pushing forward.
Thank you for raising that. I mean, there's so much going on in Mid Wales at the moment that it's difficult to keep pace, isn't it? Thank you. That leads us then to Steve's report as lead chief executive.
Thanks, Viv, and taking your lead. I won't read through the whole report. I guess the first thing to say is that it's really good to be back. It was a lovely drive up this morning from Carmarthenshire. No, it really was. I was just talking to Jack about all the silaging, is that the right word, that's going on. I'm a city boy, so I am learning these things. 4 years in Wales, it's starting to rub off. And also to offer my sincere thanks to Carol for everything she's been doing as lead chief exec. And Carol and I have obviously met to do a sort of formal handover and make sure that we don't lose any momentum. As part of this role, members will know that I also take responsibility for chairing the Planning and Delivery Executive Group, and there's a report on the agenda from that group as well. I have, as part of the refresh, looked at the membership around that group to ensure that we do have the right people to be able to push forward the agenda we are all looking to secure. So I have formally asked the Chief Operating Officers and Workforce Directors to join that group, because actually when you think about our challenges, they are either in operations or quite often in workforce, which underpins so much of what we do. And what I'm keen to do with that group is ensure that we focus on a few key deliverables for this year to ensure that we get those things over the line. So since taking up the role, I've had 3 meetings with that executive group and have been busy with Peter and others specifying some deliverables for this year. that I'm keen to see are in place, and I look forward to giving the committee further updates at future meetings about where we get with that. The report I've put in today actually focuses probably more on strategic issues, things that touch on the whole of Wales or larger parts of it, but I think are really helpful in terms of context for us. You'll note there's an update there on the development of the major trauma network in the south of Wales. I think the first thing to point out, I'm sure people will be aware that in North Wales they've had a long-standing major trauma network supported by the centre in the Royal Stoke. This is around how we organise across the south of the patch, but clearly some implications there for the Mid Wales area. So that work is ongoing. You'll be aware from a Hywel Dda point of view that we commenced an engagement exercise on the proposals to establish a trauma unit in Glangwili as an interim unit prior to the proposed new build that we've set out in our strategy at board last November. And I think within that clearly some concerns to ensure that we're clear about the role of Bronglais going forward, because Bronglais does have an important role to play. And as I've said at pretty much every meeting nationally that I've been at, Bronglais is probably fairly unique, actually, in the sort of role that it needs to have, because it won't be able to ever sort of tick the boxes of a trauma unit in that it won't have all of the right specialties to allow it to do that. However, we do need to ensure it has the competencies to be able to deal with trauma as it comes through the system. So that work is ongoing. I think the other thing to point out with this is it's thankfully very small numbers. And there is no proposal at all to change the emergency department arrangements or how Bronglais supports minor and less severe trauma that it currently does, which makes up the largest numbers. So that engagement's going on, and we look forward to hearing everybody's views on that. I've also set out the plans, the next stage of our plans from Hywel Dda's point of view on our transforming mental health strategy, with the establishment of a 24/7 mental health drop-in facility, and that we're in the process of implementing that now. I think that's a very welcome development, I think, on everyone's part to ensure that we have a full functioning 24/7 service that allows people simply to drop in. And you'll be aware of our strategy is to essentially have no waiting times for people with mild to moderate mental health problems. I'm glad to say North Ceredigion and therefore the Mid Wales area will be one of the first places that we'll establish that with a plan to bring that in by January 2020. Although I would point out that they're already implementing, and those services are coming online as we speak, and the feedback so far, both from staff and service users, has been hugely positive. I've also included an update on the long saga of the MRI scanner at Bronglais Hospital. I can remember this being an issue when I first arrived 4.5 years ago now. Delighted to say, with the really hard work of the team, that the new scanner will be in place from December 2019. I've seen the works myself. It's a very complicated site, as people will be aware, to do this sort of big project, and it's coming on really well. Members will also, I've no doubt, be aware that the current scanner is no longer operational, and that was something which just demonstrated that there was an urgency around getting this new MRI scanner with much bigger capabilities in place. There are contingency arrangements in place to both provide a local service with a mobile scanner, but also services down in the south of the patch at weekends with Bronglais staff travelling down to support it. I'm not going to defend that as ideal. That's not what we want, but actually we do have a light at the end of the tunnel with the new scanner coming online, which will not only pick up the work that was currently being done, but actually enable us to provide more scanning for more patients than we currently do. So I would rather have had it in place before the old scanner finally gave up, but that didn't prove to be possible with the timescales. I think I'll probably leave it at that and take any questions on the paper with your permission, Chair.
Fine. Any questions? All right. Yeah.
Gai just gofyn cwpl o gwestiynau. Oedden ni'n gallu cael sicrwydd bod gwasanaeth ambulans, yn enwedig yr ambulans awyr, yn mynd i fod ar alwad cyson a rhwydd i symud unrhyw rei o Bronglais, a fydda rhaid mynd â nhw i lefydd eraill os dyn nhw mewn damweiniau drwg iawn. A'r ail gwestiwn ydy, a ein gorwelion i chi'n bwriadu parhau gyda'r gwasanaeth iechyd meddwl, neu oes na fwriad i'w symud e i rwla arall yn y dre?
I'll come in on the first question and I'll just ask Peter to pick up the second for me. So the first thing to say is you'll be aware, Ellen, that through all of our consultation process for Howell our strategy, we've been very clear that we support the idea of a 24/7 emergency medical retrieval service, the air ambulance, but also ground support. That's going to be really important for all of us, particularly in the Mid Wales area. And the ambulance service have been fully engaged with and part of the planning around the establishment of the network. So I've got no concerns about ambulances being able to support patients to be transferred from Bronglais. That planning is going on, and actually it happens every day anyway. So I'd be confident that that will not be affected. Did you want to pick up the point around Gorwelion?
I can do, yes. At present, it will be Gorwelion, but as you, I'm sure, are aware, there is a move to go to a better premises and to find a better estate to work from in the future, and that will be in the next stage of the plan. At the moment, the work is being done in Gorwelion, just to make sure that we move forward, but it will be a new site at some point in the future.
Can I come in on that last point,
Yes,
Madam Chairman? I think the drop-in facility is an excellent idea, and I wondered whether we'd alerted the farming community to that. There's a lot of work going on, mental health issues within the farming community from all sorts of directions at the moment. Thank you.
I'll pick that up generally, but I think there's probably a bit more work to do around that. Certainly our strategy as a health board, which was based on the Trieste model, which is about having no waits, drop-in sort of hospitality beds. That was well communicated at the time, but that was 2 years ago now. So I think there probably is a piece of work for us to do to ensure, particularly into Powys and South Gwynedd, that we've had that communication plan. So we'll pick that up.
Just on that point again.
Yeah, it was just in terms of our mental health partnership and obviously the joint working with all of our around your strategy. I think part of what we need to do is sort of proactively communicate, and certainly there's been quite a lot of work done on suicide prevention, and particularly linking some of the agricultural communities. So we'll make sure that's picked up through the mental health partnership as well.
Yeah, same point, Jack.
Yeah, this is a subject, as you can imagine, Rose, really close to my heart. So certainly it will be promoted by me amongst the farming network. But also I am at a meeting in Cardiff tomorrow with Public Health Wales on trying to establish how we ensure the farming community is linked into the services that are available. Because as everybody knows, us farmers are appalling presenters. So I think it's going to require more outreach rather than just promoting where things are.
Thank you. Question from the CHC.
I really welcome the mental health strategy and the 24/7 drop-in. It's a brilliant thing. But is any of it remote? Can people phone in? Can people Skype in 24/7? Because you have a very rural community. And it's great having a centre at Aberystwyth, but if I live in Knighton, it's not very helpful. So having a emergency line, if you like, that people can actually phone in or Skype might be maybe an addition to this, which would be really welcomed in rural Mid Wales.
Yeah, thank you. We'll take that back. I think the team are looking at all of the digital options as well. So this isn't just about physical drop-in. It's about how we allow people to get access to support as easily as possible. It will, in time, also have beds in it as well, though. So there does need to be a physical location for it. But I think it's a big step forward for Mid Wales to have that, because I know there's been a problem for a number of years. So I'll take it back to the team. I know they're ambitious around digital and how they can use that to support. I think they've probably already got that in their plan, but I will double check.
Okay. Thank you. Any more questions? Oh, Jack, yes.
Hi, Steve. Just one question on the national digital development that you mentioned in your report. One of the things that's cropped up in our engagement events is the inability of anybody to talk to anybody else. So as there is an initiative nationally, can you ensure it's linked into the work we're doing locally on that as well? Especially as there appears to be some money available.
Yes.
Digital, my favourite subject. Having sat on the other side of a Skype meeting with Viv was chairing in Cardiff on Friday with the weirdest delay. It was like I could hear myself coming back. I just know how frustrating these things are. I think all I would say is absolutely there is some money at Welsh Government now available to try and take this forward. The division between the sort of national spine and then being able to move towards a sort of plug and play type arrangement, and I'm sorry, I'm talking as a complete non-digital person here, but as I understand it, should mean we can find our own solutions with interoperability, which will mean we're not waiting for a kind of all Wales approach all the time. I think that may free up a lot of initiative for us to be able to do it ourselves, but it's very early days around that.
Yes.
Yeah, we're in the process of setting up an intervention and prevention unit within the council and working together with colleagues from health and police and whatever. How are you going to ensure that you have a single platform that everybody can use to access the data about individuals? That's key to all this, I would suggest. And can I also just pick up on the mental health as well, which I missed out, is what provision is there for younger people and mental health facilities?
Again, it's at present, it's adult mental health that's in Gorwellian, as you know, that we have at the moment, and the team are working on the next stage of that, which is to, according to the strategy that we have already, is to develop that children's services, and the transition age group is the important age group for us to work with.
Thank you. More questions? Right. Yes, I mean, they're talking about 5G in Cardiff. I mean, we're lucky if we've got 2G in parts of Powys.
Welcome to my world.
Oh, yes. But it is important for us to keep on putting pressure on them to ensure that we are not neglected in rural areas. Right, the next item on the agenda item 4, is the Midway Joint Committee's Priorities and Delivery Plan Update Report. And Steve and Peter, this is for you. So we do have a paper which I can refer you to.
Paper 4.
Yes.
So I'm going to ask Peter to take us through your permission, Chair.
Yes, fine.
Okay, thank you for that, Steve, Chair. In terms of the priorities actions, we refreshed those when we moved into the new joint committee and with the new chief exec and chair, and also discussed them in depth at the clinical advisory group. The clinical advisory group have also agreed these as priorities for them going forward. The number one priority that the clinical advisory group had was ophthalmology and how ophthalmology was working across the patch. We were working with the operational teams across the health boards with regard to ophthalmology, and unfortunately the operational teams did not have the capacity in terms of resource and manpower to be able to move this forward. They got into a position where they got slightly stuck in terms of progress. So it's been decided now that I will take over this work stream myself and drive it forward from a Mid-Wales point of view. And I am responsible for the first missed objective, which was to get the information ophthalmology plan to this meeting. And it has been delayed by me. I take responsibility for that due to the fact that I need to understand the working relationships between the health boards and the commissioning processes and the numbers to be able to get us to a position where we know what we need in the future. So at the moment we are gathering information from health boards across the Mid-Wales patch to understand what the primary care need is, i.e. the high street position in terms of what's required in the high street in terms of optometrists and opticians in the high street, and also the data for secondary care around cataracts, but also around wet AMD and other services that are required from a secondary care point of view, and how some of that could be delivered in the primary care sector. So in terms of ophthalmology, that's where we're at present, and the revised plan is in the paper that you have in front of you. I don't intend going through on this page by page, otherwise we could be here for a long time. One of the highlights of this now is that we do have a lead for each group, which is important because we were at a point where we didn't have leads in place across the patch. And we are progressing with some demonstrable deadlines and timelines with people, and some more detailed plans behind this report to be able to measure progress as we are moving forward into delivery on some of these items. Some of the issues are quite big when you look at things such as respiratory services across Mid Wales. That is a huge amount of work and a lot of discussion and interaction between both providers and commissioners across the patch. And you look at other areas such as WCCIS, which is the information system that is in Powys and is in Ceredigion Local Authority, but isn't in other areas yet, and how we're going to roll it out to get the communication between those areas sorted. I've now got the privilege, I've just been told this morning at 8 o'clock, of being the SRO on the delivery of WCCIS for Ceredigion. So thank you very much for that, Steve. So there are some sort of complex information systems that are going to have to talk to each other there, and the point was made earlier about how that is going to work. And then we look at telehealth and technology and digital, and how that is now moving forward, and some areas that have been successful in that area, but also some areas that need further expansion and work up across the, again, commissioner-provided units. Integrated care hubs. Integrated care hubs are a focus for a number of us across the patch. As I keep saying in all the sort of meetings that I present on in terms of Aberystwyth and Cardigan and others, is that these are buildings, it's teams and people working together that will deliver the result. The building is an enabler, but actually it's working together and taking down the operational constraints across the area that will help to deliver the support and care that people need. In terms of the workforce group is moving forward, and there's really good communication and some meetings happening between workforce directors and workforce teams across the patch to deliver what is a workforce plan for Mid Wales going forward, and that's well described in the document. And again, clinical networks, again, easy to say, let's build a network, let's join up and talk to each other, which actually makes common sense, but actually isn't as easy as people would expect in terms of getting that connection. We have a meeting tomorrow across Shropshire, Powys, South Gwynedd, Ceredigion, of clinical people in a room together to talk with each other about how we might supply services and how we may work together, most probably outside our comfort zone, i.e. providing services that are further away from what I like to refer to as the mothership. A lot of our clinical sort of people in the secondary care sector like to work within a hospital setting. They like to be within a hospital and have a risk strategy behind that. And what we're trying to do is get them to come out of those hospitals and work within the rural areas that we see and work in every day. And that is, it's welcomed, but the teams will need a lot of encouragement and work together to be able to get that to happen. So we're working on that, and that's a good meeting we've got tomorrow around that. And Wyn Parry is leading that work for us in terms of the medical director of Powys. That, I think, will be a summary of where we're at. Chair, I'm happy to take any questions or any thoughts from anybody with regard to the paper.
Yeah, I mean, it's very reassuring to see how much work is going on. It's important that, if anyone does have any questions, now is your opportunity. So, Jack, yes.
Just one, two things, Peter. One, there's probably lots of other people in the room who've got no idea what your acronyms stand for. So don't talk in code. The other one was, On the dental services plan, when we were in Towyn, people there were quite keen on the idea of maybe accessing Newtown from Towyn because of the links. Yeah. So I see in the work plan it's talking about Powys and Ceredigion, but there might be a further catchment population that's worth thinking about for that.
Yeah, we are exploring that, Jack, now as a sort of secondary phase of that, and the team that have been doing the work on that have linked in now with Betsy Calwarda because of the Towyn event, which I was at and picked that up anyway. So
That's good. Yeah, thanks.
Swn i'n cymryd 2 pwynt os gai. Ar yr un integrated care hubs, yr hwbia gweithio'n integredig, dwi'n siŵr na fyma ddylwn ni godi o, ond profiad ni o'n i'n efo tîm integredig ni'n Tywyn chydig yn ôl. Ac un o'r prif issues maen nhw'n gael ydy'r trafferthion rhwng pobl sydd efo GP yn Powys neu sydd yn Bron Glais, ond ydy Bron di Hywel Dda ddim yn allan siarad efo community resource team yn Tywyn y fath a fysa nhw'n sir I hynna'n. Wedyn dwi'n meddwl bod ni efo chydig o waith I wneud pan dydy lle mae rhywun yn byw a lle pa fwrdd iechyd ddim cweit yn gweddu. So dwi'n gwybod, ella gofyn ydw I, ydyn ni angen grŵp penodol ar gyfer, dwi'n gwybod sut ydy'n unigryw I De Gwynedd, ond yn sicr da ni yn y lleiafrif pan mae'n dod I Bron Glais. Wedyn mae'n idrach fel bod staff Bron Glais ella yn nabod staff Ceredigion ella'n well. Wedyn dwi'n meddwl bod mwyn I ni beidio cael yr oedi i'r unigolion, mae'n bach o waith I wneud ar hwnna. Ond yr ail beth oedd o dan yr un gweithlu, o'n I mewn digwyddiad wsos dwytha yn Gaerdydd a mae'r HIW a Social Care Wales yn gweithio ar ei strategaeth gweithlu nhw ar hyn o bryd. A oedden nhw'n adrodd yn drafft a prif benawda, ond o'n am llawer o'n byd am gweithio mewn ardal wledig yn dod allan cweit yn ei headlines nhw. Nes I godi o, wedyn maen nhw'n mynd I drio sicrhau, ond ella bod ni angen cryfhau sut ydan ni'n gweithio efo'r criw sy'n datblygu'r strategaeth yna. Dwi'n siŵr bod ni, ond o'n I wedi disgwyl gweld o'n hynny ar iaith Gymraeg oedd o ddim I weld. Wedyn swn i'n gweld y ddau beth rili yn canu drwy'r adag pan mae'n dod I strategaethau gweithlu. Diolch.
Well, yes, a lot of important issues there. I mean, in Powys we are working with HEIW because crucial that we get involved now at this stage when they're developing the strategies. Who wants to take this? I think Hayley's got something to say.
Yeah, diolch yn fawr iawn am y cwestiwn. Just in terms of Social Care Wales HEIW, there have been several workshops where they've been participating, and particularly Chris Jones was chairing one of the sessions. So although perhaps the paperwork yet doesn't reflect it, I know that there's been very active discussions about the need to focus on rural health and social care in Wales, and also some very early discussions about what that would mean from a rural academy or from an education and training perspective. So I think it's a work in progress, but I do think that there is a recognition strategically by both partners that they need to do that. And obviously part and parcel as well is the Welsh language, and that was also discussed in a workshop I certainly was at in Bilthwells fairly recently in the last few months. So I think it is something we need to keep an eye on and continue to push forward, but I do think there's a general recognition with both organisations there. And I just wanted to reflect the point about what it feels like for particularly frontline staff on the ground, our district nurses, our social workers who are working across our boundaries, our organisational boundaries. Certainly I shadowed a district nursing team in the Machynlleth area and visited a couple of patients that were resident in Gwynedd but actually were receiving community nursing from Powys. And I think we've got a lot of work to do there. So I think building on Peter's point earlier, it's not just about physical space and facilities, it is about how we work together and getting some of those relationships better established, but also making sure that we're very clear around process. And certainly some of the frustrations that frontline staff share is perhaps different processes between different local authorities and different health boards, causing a little bit of confusion. So I think your suggestion about looking at that at a very operational basis is very important. Perhaps we could pick that up as part of our joint working around integrated working under this banner, really.
Yeah, I mean, patients don't really care, you know, which health board's delivering their care, as long as they get it. Peter?
Yeah, just to come back, really, if we go back slightly, I think 3 meetings ago, there was a presentation, I think actually in this chamber, around integrated CRTs and how they might work together in terms of the future. Those meetings at the moment have run into chairmanship problems, so I will again take it on to rekindle those meetings and make sure that they get sorted. On a day-to-day operational issue with regard to discharges for bronchitis, I've already asked the general manager there to set up a small working group to be able to discuss discharge with the CRTs within the South Gwynedd area, because there is a potential there for some conflicting advice and guidance to be given, and so I'm expecting her to do that from an operational point of view.
Steve?
Yeah, I think that point's probably largely been made, but I think you do raise a really challenging thing for us about how teams work together between hospitals and community, between hospitals and communities and other local authorities. I guess one of the reflections I have is that even within a health board, getting our teams to work together is quite difficult. So, you know, we have issues with people who are admitted, say, to Llangwili, need to come back to Ceredigion, and just getting our own community teams to engage with that. So I think we will take it back to the executive group. I think for me, there's something, my gut feel is there's something about how we just get people in a room so they meet each other, because it's who you know, isn't it? It's quite often it's the human face, particularly between our hospital staff and the community resource teams, as Peter says. I think there's something we can do just to practically start to build some of those relationships so people know who to pick the phone up to when they need to. And the other point you mentioned around the sort of workforce issues, I just wanted to kind of underline from our point of view the real importance around the apprenticeship scheme that we're putting in place. Some really significant interest actually from our local population around getting involved. We've got 10 places at the moment in Ceredigion. I would like to see that widened significantly, because actually in the end, as I alluded to in my earlier paper, workforce and the ability to have a sustainable and good workforce to support our services is sort of the key to everything. So I can see this growing and growing over time. We've got to think about Towyn and Powys as well in all of that to ensure that what we're building is a workforce for Mid Wales, not just a workforce for bronchitis, which I think is important.
Thank you. Ellen, you were next, and then...
Diolch. Dwi'n falch iawn o glywed oddi wrth cydweithiwr i mi bod yr cynllun newydd o gael 12, dwi'n meddwl, o meddygon sydd yn hyfforddi i ddod i weithio o amgylch cylch Aberystwyth a cylch gwledig wedi bod yn arbennig o lwyddiannus yn ôl beth dwi'n deall. A felly dwi'n just yn gobeithio bydd hwnna'n parhau, a fe welwn ni ymhen hir o hwyr bod rhai ohonyn nhw yn dymuno dod yn ôl i weithio unai fel meddygon teulu neu yn yr ysbyty, fel mae amser yn mynd yn ei blaen. Ond dwi hefyd yn hynod o falch wedi bod yn trafod gyda'r athro Elizabeth Treasure yn y Brifysgol Aberystwyth bod hi'n gweld y posibiliad o ail gychwyn mewn gwirionedd i hyfforddi nyrsys yn cylch Aberystwyth. Bydd hwnna yn cam ymlaen, bydd ni gyd yn edrych ymlaen ato fo, achos dwi wedi dweud o'r blaen, yna ni'n fyfyriwr ond y dri llonti o nyrsys yn cael ei hyfforddi yn Aberystwyth, a dwi am weld hwnna yn dod nôl i ryw raddau beth bynnag, fel bod ni yn gallu cadw'n pobl ifanc yn fwy lleol, a ddim gweld nhw'n hyfforddi'n rôl ymhell, ac yn diflannu dros y gorwel fel sy'n dieddol o ddigwydd. Felly mae'r ddwy elfen yna yn bethau dwi'n chroesawu'n fawr. A just ar sail yr adroddiad ynglyn â'r hubs, dwi'n falch o weld Aberaeron bron yn barod, Aberteifi ar y gorwel, ond byddwch chi'n falch o wybod, a diolch i Carys a'r tîm, bod cynllun busnes Cylchcaron yn wylo'r swyddogion. Wedyn, dwi'n gobeithio gawn ni newyddion da fanna cyn hir.
Good, very optimistic then. A couple of questions from the CHC table, if I could go with that down there. I don't know who was first.
Can I just throw another problem into your mix of getting health boards to work together? One of the concerns that I have, particularly in North Wales, and I'm sure it's as true in Mid Wales, is when patients are treated in England and are discharged from England, not transferred back and then discharged. And the support services and everything then seem to just fall into a black hole. And I know this happens quite a lot in North Wales. I'm sure with your links with Shrewsbury and Telford and your links further afield, that may also happen. I've known it happen with trauma patients who've been discharged from Stoke, and also patients who've been discharged from Walton, where they come home and all their follow-up support is then sent to them to go back to Stoke or Walton, when there is actually a far more local support network they could have linked into, but they're told, no, you're not part of that because you had your treatment there. Doesn't seem to happen if they're transferred to a more local hospital before they're discharged. It's the discharge from England that seems to cause the problem. So I'm sorry, it's only throwing another problem into your mix. But
it is one that we're aware of. Hayley, if you want to take that.
Yeah, I appreciate there will be instances where, you know, patients, perhaps from a care coordination point of view, perhaps it isn't as joined up as it needs to be. And I think it's an issue for specialised services, and we work as part of the WISC, Wales Joint Committee for Specialised Services, where in fact we only had a session last week with them about how do we get that. They're very complex pathways. People are going to a number of different places across the border, and how do we make sure that we get that smooth transition back to people's homes or place of residence? And so I think the specialised element is, you mentioned major trauma, that is something that certainly, if you consider the engagement work that HOAV are doing at the moment, there's particular parts of the pathway that do lend themselves more to a local provision, so the rehabilitation part of the pathway. And I think there's a lot of work we're doing currently around various pathways. Also, in terms of a single cancer pathway, there's been quite a lot of work we've been doing around improving the cancer journey with Macmillan to make sure that patients' care is coordinated, and that we particularly that point when they go straight home, as you say, that the appropriate wraparound support is there. I just wanted to mention there's been quite a lot of press coverage on cross-border issues fairly recently, obviously, and that's impacted particularly on Betsy Health Board, but also we've had a number of questions in Powys because a large proportion of our activity goes across the border in England. We do have a very well-established cross-border statement of values and principles that we work to between Welsh Government and the Department of Health, and also between us as health boards in Wales and providers in England. And that covers all aspects, whether that's the fact that some of our patients are registered, some people who are resident in Welsh counties choose to register with English GPs, and it also vice versa. We have English residents also that are registered with Welsh GPs. So again, there are some issues that we have to deal with on an individual patient level, but certainly there's been a strong focus recently about getting some of those pathways clear and sorted. And I think my reassurance here is that in the cross-border statement, recognising there will always be cases which we deal through concerns or perhaps through the complaints route, the principle is that no patient's treatment should be delayed due to perhaps differences of opinion between NHS Wales and NHS England. And that principle we work very closely to and we monitor as well. So,
yes. Thank you. Gavin.
Two very brief points. In the little report about the Abereiron Integrated Centre, I was interested to be introduced to the concept of the agile use of a building, and I was pleased that there was an explanation of that, because the mind boggled at first about how a building could be agile. But I thought that it's a small point, but there's an interesting point around the notion of integrated working and the development of relationships in a multidisciplinary way across different health professionals, and the use of space. And I thought there was a little study there that perhaps Mid Wales rural healthcare could take on, because it's a small point, but it's an interesting point, and the whole notion of space and relationships and how people respond as a result of hot desking rather than having their own little territory and office space is an interesting one to explore. And then just briefly to follow up Ellen's point about the medical students who've been working in GP practices and in Brongleis Hospital. I went to a very interesting set of presentations by those students that was at the Aberystwyth University Forum. And each of those students, I think there were 11 of them rather than 12 of them, did a presentation on the studies that they'd conducted while in GP's practices and working in Brongleis Hospital. And they were of very high quality. Some desk studies around patient records and so on in different areas, but also some observational studies about procedures and relationships and so on. And they were strongly encouraged to make these available to Brongleis, and it was suggested they were of publishable form, but they were very, very useful and, you know, nice little studies, and you know, a good source of feedback about Brongleis services and outreach and primary care. Well worth looking at.
Thank you. Yes. On the somebody has already mentioned HEIW, Health Education and Innovation Wales. Jack, sorry about the acronym. If there were enough interest in this, we could ask Dr. Chris Jones to come out here and speak about it, if people would like to ask him questions, or if you'd like him to explain a bit more about their work at the next meeting. So I could look into that if you're happy for that to happen, because they are doing a lot of very interesting work at the moment. Thank you. Yeah. Were there any other questions? No? Thank you for that. Shall we move to the next agenda item then, which is Hayley going to talk about the North Wales Wellbeing Programme. So just to give us an update.
Thank you, Chair. It's a very short paper that's been included in the pack, but we're really excited. Both, I know Rosemary's left the building, but as a local authority in Powys and Health Board together through the Regional Partnership Board, we've been working for some time together, and on the back of an approved 10-year strategy, which is the Healthy Care in Powys, we were able to develop a transformation bid to Welsh Government to take forward what we consider to be one of our flagship programmes of work. Very pleased that Ali sat next to me here, because Ali and I are joint senior responsible officers for this work for Powys. You know, the money that we've had from Welsh Government has been very important to be able to help us pump prime the work and to get this really exciting programme of work started. Just in terms of a quick introduction, I think what you'll find, and we're very happy to provide more detailed information about this programme, because I think one of the benefits of Mid Wales Joint Committee is that where we are transforming across the patch, or we've got good practice, we need to be actively sharing that and asking ourselves the question of what can we learn from each other and how can we roll out and develop that further across Wales. We're really pleased, because this is a project that not only talks to a healthier Wales in terms of the traditional health and social care working relationship and priorities. We've we've really had a very strong focus on well-being, early help and support, and particularly the broader economic impact of this programme, working in partnership, looking at more broadly with public service board partners, but also housing, leisure, and how it all fits together in terms of this development. We did a lot of work. We identified the need to focus on North Powys in terms of the concept of a rural regional centre, and that was prioritised on the basis that we've got Newtown in particular as the main sort of population centre in Powys has got a number of challenges, and I don't know if you've seen the latest child poverty report, but the figures in terms of Newtown is quite stark and comparable to some parts of inner city London. So it is a very important priority for us. So we're at the very much at the start, and I think we talk about clinically led, but this is about professionally led from the point of view of multidisciplinary joint working across the whole local authority, with the health board's disciplines, but also generally with the police, with the ambulance, but also the most important part is the community and the population itself. So the principles of co-production and how we're engaging and taking this forward is core to the development. And we'd be very pleased to be able to report at a regular basis, perhaps not too frequently because we're right at the start, but perhaps in 6 months' time we could come back and share with you the work that we've done to find out what the local population issues are, what the gaps are, and particularly how we can move this forward. Peter's already mentioned a workshop tomorrow that's been planned with clinicians across the patch. One of the issues we're trying to deliver through this programme as well is to make sure that people aren't travelling unless they absolutely have to for certain services. And we know we can do more in Powys, both in terms of the traditional sort of pre-op assessment, outpatient diagnostic work, and even potentially sort of day case activity. Some of that's already been looked at, and we've been working in partnership, for example, around the dental, etc. So it's really exciting. We'd be very pleased to share progress as we go along, but also we know that across Midway, as people have been successful in other transformation bids and proposals, and I think it would be really helpful for us to sort of bring that learning together and make sure that we can roll it out at pace for this region, because I think for us in particular the design has to be rural proofed, and the rurality proofing of these models of care may bring a different set of solutions to what perhaps traditionally other areas of Wales may be considering, and I think we've got the potential to roll out quite a bit of learning. I don't know, Ali, if you wanted to add anything.
The only thing I'd add is, the commitment from the council to work collaboratively with partners, much broader partners than the health board and social care, just to really deliver those improved outcomes for the local population. I think the one thing that Hayley didn't mention, because you've covered it all so lovely there, is that a few weeks ago we had our official launch of the programme, and we held a number of events in North Powys, which was very well attended by members of the public, really engaged in the work going forward. And I know both of us at the end of that day were really proud, weren't we, to be the joint SROs. You know, our workforce turned up, our residents turned up. There was a really good opportunity and a really good I guess vibe is probably not the right word, but it's the word I'm going to use, in the rooms. Really, really positive experience, the launch. I think it's a really good programme. We are very excited about this piece of work, and that's probably all I'd add.
Thank you, Ali. I mean, the emphasis today has been very much on health, but this is care as well. It's excellent.
I mean, this programme of work is much broader than health and care. So certainly, as Hayley mentioned, you're looking at the broader partnership opportunities, working with education, housing, voluntary sector organisations, and really, wellbeing's got such a broad definition, hasn't it?
Yes, thank you. Any comments or questions?
Just to add, really, and to apologise that the West Wales Regional Partnership hasn't presented a paper here today, and I think that is something we will rectify for the next meeting. But on the back of that as well, just to say that we've had 11 million within the West Wales Partnership, and again, very much based on the same principles that Powys have gone. It's wider than just health and social care. It is about all of our partners out there. and we've had 7 million to develop on the technology-enabled care, which then, again, you know, in terms of rurality, is critical, really, in terms of people who can't travel or you know, are unable to travel to various settings, but also 3 million for the fast-tracked integrated localities. And it's something, you know, that we're looking at it as a locality model. So Peter and I are certainly working very closely in Ceredigion around developing it. And what we have agreed is that whilst there are regional priorities, it will be local delivery, because each of our localities, even within Ceredigion, are different. So, you know, across Carmarthenshire, Pembrokeshire and Ceredigion, again, it's a very different area. But also we were recognising the interconnectivity then between, you know, South Gwynedd and Powys and Ceredigion, and work that we need to be doing there. And also then we've had 1 million for connected communities, and that is about really sort of rolling out how we can develop some of the community networks that we now need to re-establish, if you like, within our communities, because, you know, society has changed so much over the last 20 years that, you know, we're having to reconnect, I guess, a lot of services in our communities. But we will provide a report for the next...
Thank you very much, yeah. I mean, it's about learning from one another as well, isn't it? Yeah. Thank you. Jack, yes?
When we were in Newtown, obviously this was hot off the press for our engagement event, so you completely swamped what we wanted to talk about.
Sorry about
It was shocking. But it's fine. But you're probably connected into them, but there were a few people who turned up who were successful in getting, I think it's called the NRO bids for social prescribing or green health initiatives. So as well as ensuring that you're interconnecting with, you know, business, and that there is a plethora of transformation money around. So that's another one that you need to keep an eye on, because those people were keen to link in with you as well.
Peter?
Yeah, just to come back really, in terms of learning and shared learning, as the sort of vice chair of the Kilcarron Project Board, I think there is some really good learning that could be done there in terms of 3-way, 4-way partnerships, etc., and also the fact that we may well be integrated at our level, but at other levels they're most probably not as integrated as we think they are. So that might be useful for you.
Right, shall we move on then? Thank you for that. Now, Bronglais General Hospital, we have a very large volume of information here. Very interesting. Peter, do you want to just speak to that?
I will just speak to that, and I promise I won't go through every single page. Firstly, I'd like to thank the core team for this document. There has been an awful lot of clinical engagement and engagement from teams across Bronglais and beyond in terms of community services as well in this document. Again, I would emphasise that the document is about providing services. It's not about really saving Bronglais Hospital. We've been through all that. That's sort of part. And you know, this is about building Bronglais and its teams for the future. And Hayley quite rightly made the point again earlier around outreaching and reaching out to our communities and providing services as close to people's homes as we can, as a Healthier Wales would expect us to do. And you know, this document is about securing Bronglais and ensuring that we have a platform on which to deliver services out into communities for the future. The big thing in here is around building the teams. The document gives people a recognition. It gives the staff in Bronglais and the population some clear outlines of what is going to happen and what the expected future strategy is, and also for a substantial part of our population about how Bronglais is going to reach out and work with them further away from Bronglais Hospital and out in the community more than it does at present. The document will be extremely useful for us in terms of recruitment, because it will give people an outline of what the expectation is and how the services are going to develop over the next few years. It is a draft document at present and hasn't been through an approval process as yet. It has been consulted on with various groups and individuals across the Mid Wales patch and beyond in terms of its content. But I'd be happy to take any questions from anybody with regard to the document or anything that's in it, Chair, if that's okay.
Yes, that's fine. Very useful document to keep. As far as I'm concerned, anyway, I can refer to it from time to time. Thank you. Any questions? Everyone happy to receive that? Did you have a question, Gabrielle? No? Gabrielle, yeah?
It was quite, I mean, it was an exciting document, but it's quite difficult to get one's head round all the different components and how they were going to come together, and how the main themes were going to resonate through each aspect of the provision. But one thing that did strike me, which at one level was very nice, but then I couldn't see how it was being followed through, and that was the notion that the service as a whole is going to be kind. And I thought that was a very nice way of expressing that. But then I thought, well, how do the providers know it's kind? And I didn't see any reference to what I saw as objective feedback, because the only really objective feedback I would have thought would be from patients and the public as to whether the service was kind. I could see how other dimensions that you mentioned, because you mentioned 4 key principles, one of which was kind, another one was accessibility of services. I could see that the feedback needed to reflect the views both of the providers but also of the users. But I thought the very nice reference to kindness of service really needed to reflect in the section on how do we know we're doing well, the whole part that the public will play, and you'd expect me to say this, perhaps had been overlooked or not mentioned, because the users are the ones that will be able to tell you if it's kind.
Thank you. Peter, do you want to do that?
Yeah, just to say yes, I take your point, and we'll explore that in the next iteration of the document. There's the evaluation, I think, is going to be quite critical in terms of getting the feedback and how we get feedback from our service users and the public in general, really. So I think there is, I've noted that, and we'll work it out.
Steve, did you know?
Yeah, thanks, Gabrielle. I don't think I've ever had anyone tell me one of our documents is exciting. So first of all, I want to just take that moment to enjoy that we have an exciting document.
I've written that down.
I have too. Those 4 words have actually guided the whole of Howl's whole strategy across the health board, and they were. They did give us a lot of pause for actually what do we mean by these things: safe, sustainable, accessible, and kind. And I think it's the sum of all of those things which is important to us. We've got to get all of them right. There's no sort of sense of trade-off between them. It's more that actually they are the 4 things that will be our hallmark. And I would say I would just slightly come back on, it's not just about patients, it's also how we're kind to our staff. And actually one of the key reflections for us when we started the strategic discussion was, first of all, understand from staff how it feels to work in our NHS at the moment. We know the pressures. So I take your point, it is about patients, it's about the public, but it's also about our staff. This is one of a suite of documents which have been emerging from Haldar really over the past sort of 6 or 8 months. And another one that we brought out in January through our public board meeting was a commitment to continuous engagement as part of all of this. Because even though we've got a clear strategic sort of view about where we want to be, actually we have to continuously engage with the public and our patients and our staff about how we're going to get there and whether that changes over time, because strategy gets old quite quickly if you're not careful. So we take that absolutely at the heart of what we're trying to do, and it links to what Keris was mentioning earlier around the development of our locality structures. Actually, we want to embed engagement. How does it feel within all of our work, right down at the locality level, so that we're constantly engaging the public and our staff in taking things forward. So I don't think we've cracked it, but I think holding us to that high standard of actually, if it's going to be kind, we need feedback on how it feels. That's got to be the hallmark of how we're going to do things for the next 20 years, I think.
Thank you. Sorry, who's next?
Diolch am gael gweld yr fersiwn drafft. Gan I just ambell sylw ac ella bod fi'n ailadrodd chydig, ond nes i fynd syth at y dan oedd yn siarad am gweithio ar draws ffinia i weld os oedd hwnna'n mynd i gyfarch chydig am pwyntiau cynt. A dwi yn meddwl yn sgil y drafodaeth ella sa hwnna'n medru cael ei gryfhau i enwi'r partneriaid a trio roid ryw fath ystyr i'r darllenydd. Os ydych chi, enghraifft, yn Ne Gwynedd, mi fyddach chi'n rhan o tîm ella cymunedol, i chi beidio teimlo bod chi'n cael eich gollwng pan ydych chi'n mynd i fewn i sbyty lem. Dyna di profiad nifer o bobl bod nhw'n cael ei ddim yn rhan o'r gymuned ddim mwy. Wedyn, dwi'n meddwl sa fo'n medru cael ei gryfhau, a mae siŵr yn linc di hynny, swn i'n licio gweld, a dwi'n siŵr sa Ali a Caris yn cyd-fynd. Does am llawer ar beth sy'n bwysig a what matters yn dod drosodd yn hwn, ac ella bod na gyfla i ailadrodd hwnna ar y cychwyn, jyst i ddweud beth sy'n bwysig i chi, sy'n gyrru'r holl ddogfen. A'r trydydd, ac cyn bwysigiad ar ddau arall, does am byd yn amlwg i fi bod yr iaith Gymraeg yn canu drwy hwn o gwbl. Ella bod o yn y ddogfen yn rwla, ond dwi wedi sbio arno fo, a di sbio arno fo eto heddiw, a dwi'm yn weld o. A dwi'n meddwl bod yna rhywbeth ynglŷn â sut mae'r agweddau iaith Gymraeg pan mae rhywun yn cael gofal yn un o'r prif egwyddorion sy'n gyrru y triniaeth ac yn y blaen, enwedig mewn rhai agweddau o'r ddogfen. Diolch.
Thank you. Steve?
Yeah, thank you for that. There's probably a few things there we need to reflect on. I guess 140-page document, there's always something you don't include, and there is a balance here, because actually the other thing we want this to be is something which is exciting, that people can engage with, but clearly we need to deal with some of those, make sure we're clear about some of those issues. On the joint working stuff, there are practical things, as I said earlier, that we need to be able to do. It's sort of almost inherent in the kindness part of this, about if we're going to be kind to patients who come in and then have to go back out of hospital, we need to sort ourselves out around how we work together jointly between hospitals and community teams, wherever they might be. So whilst the practicalities might not be in there, that's still very much something we're going to need to do. So it's striking the balance between something which sets a direction of travel and something which deals with everything, all the issues. I think the issue around Welsh language, I think, is right, absolutely, and we do need to reflect on that. It's such an important part of, again, having a kind service, one that ensures that people's language of choice is put first. So we can reflect on some of that. I think this is a starting point. It needs to be something which people can engage with, but actually we then need to move forward. What are we actually practically going to be doing on the ground?
Dod yn ôl ar un pwynt yn sicr, yn dyfalch iawn bod yr agwedda'n am wedi cael i ystyried wrth ail ddarllen o. Ond mae'n debyg i fi efo gwasanaeth sy'n garedig, mae o'n bwysig tu hwnt, yndi? Ond mae beth sy'n bwysig i bobl ddim yr un peth â bod yn garedig. Dwi'n meddwl be mae pobl isio weithiau yn cael ei golli bod pobl yn garedig. Wedyn dwi'n meddwl bod o'n bwysig i ni peidio cymysgu'r ddau. Ac efo'r iaith Gymraeg, dwi'n meddwl bod, a mi ydw i'n arwain ar agenda mwy na geiria, dwi'n meddwl ddyla ni ddeud fframwaith Llywodraeth Cymru mwy na geiria yn y ddogfen, a tydi o ddim yn issue o ddewis, mae o'n angan clinigol. Wedyn, dwi'n meddwl bod rhaid i ni symud i ffwrdd o cymryd na dewis, mae na ddewis iaith hefyd yn rhai agweddau, ond mae fwy a fwy ar dystiolaeth wan yn deud mae o yn angan ieithyddol pan mae'n dod i triniaeth clinigol. A dwi'n meddwl bod o'n rhoi digon o bwyslais o ystyried gewch chi outcomes lot salach os da chi ddim yn rhoi y sylw i'r ochr ieithyddol. Diolch.
Yeah, I completely agree. And actually kindness is a factor in how people feel our services, but there are others as well. Perhaps you can help us with the Welsh language bit, given your leadership role. It's something that we as a health board take really seriously, and I think we have made some progress, but it's something we've got to continue to challenge ourselves on, because you're right, it's down to safe clinical care as much as anything else. So if you're able to give us some help with that, some reflection, I'd very much welcome that.
Thank you. Hayley, did you want to speak on that?
Yeah, I had a couple of reflections really. You know, obviously this is a really fundamental piece of work that's very important, and I know the team's worked very hard on this. I think that a couple of issues. When I read this, I read it in the context of transforming clinical services and some of the broader context of our own strategy, both in Betsy, local authority, healthy caring Powys, and I saw this as dealing, I guess, with the acute element of the pathway. So I think the making sense and the referencing to that is really important, but trying to put everything into one, it's about that broader issue about accessibility, and I've given some reflections around this is quite impenetrable for many, and how do we get a sort of easy read version, perhaps that would help get the main points across, reassuring the public, but also giving them an opportunity, an easier opportunity perhaps to comment, because it is quite an extensive piece of work. I just want to reflect on a couple of things. I was very pleased to see the reference to the need to look at, you know, I think that it's got the right feel in terms of the catchment of bronchitis, and particularly the complexity around mid-Wales. And I think that certainly as a commissioner, we'll have separate conversations, because this, I think, has been written for everybody. And there are perhaps more, it's not quite an everyday version, because I think it's too much for many. But there's something also which is a bit more technical detail if we're looking at it from a commissioning perspective. So it's about the various levels at which we need to cut the cake. And in terms of that, I think there are particular issues around making sure that language is really important in terms of description of services, particularly when you're talking about mid-Wales. There are some new concepts like the rural trauma facility language being referenced in this document, and I think there's a bit of work for us to do to just really nail, are we all talking about the same thing when we talk about some of these elements? But I think it's a fantastic credit to Peter for pulling this together, and I think with a few tweaks and perhaps a bit more of a easier read version and a bit more technical detail on particularly the modelling assumptions underpinning the sustainability of some of the services, I think it could, you know, it's a really important step forward.
Okay. Thank you, Hayley, and yeah, absolutely, I would reflect the hard work that Peter and the team have done in quite a complex environment to get this right. It is, as you say, as you sort of allude to, it's a sort of provider document, and there does absolutely need to be a discussion with our commissioners about it. I take your point around the easy reading. It's something that we take quite seriously, and we've done it with our other documents. I would expect us to do it with this, because in the end it's about ensuring that the public can engage in this. This is not a document just for us to sit on a shelf. And also I would just highlight the use of the family within this, that actually when we talk about our services and bringing them to life, doing it using the family is quite helpful for people to see what it might mean to them. So again, I'd want to see that, and we can see some of it in the document, but it's something we want to do more on, and I think the major trauma engagement has demonstrated how you can use the members of the family to really describe both what happens at the moment and what you're aspiring to. And in the end, it's got to be accessible to all of our public who was there.
Thank you. Did you want to make a point?
Diolch. Gai hefyd diolch I Peter am y ddogfen yma. Dwi'n credu bod yn holl. I fi, sydd wedi bod yma o'r dechrau yn ymgyrchu fel Jack, yn ymgyrchu I gael cadw gwasanaethau yn Bronglais. Mae gweld y ddogfen yma, darllen beth sydd ynddo fo, yn galondyn mawr, a mae o'n gamau breision ymlaen I le oedden ni, pan oedden ni'n meddwl bod ni'n mynd I golli'r cwbl. Dwi yn ddiolchgar, dwi'n gwybod bod yna bethau, mae angen tweetio, di bob dim ddim yna, ond mae'r weledigaeth o lle dyn ni eisiau cyrraedd yna, a dyna sy'n bwysig I fi. Dwi'n credu bod rhaid I ni fod yn cydweithio nawr, i'n siŵr bod ni yn gweld y weledigaeth yma yn dod I fodolaeth. dim ond gobeithio bod yr arian yna i sicrhau fod a bod yna staff allan yna sy'n bodlon dod i weithio i Aberystwyth, lles yn cymunedau ni gyd, achos mae cymunedau De Gwynedd a Powys, Gogledd Powys hefyd, wedi bod yn ysu i gael y gwasanaeth yma yn y canolbarth. Felly, diolch am y ddogfen ar weledigaeth a fel mae Morena wedi dweud, mae angen cael mwy na geiriau mewn i hwn a'r cysylltiadau gyda ni yn y cymunedau, yn yr gwasanaethau cymdeithasol sydd yn helpu i gynnal y bobl bach yma pan maen nhw'n dod allan o'r sbyty. Diolch yn fawr, Peter.
Thank you. Right, well, I think, will we see a simplified version of it as well at some point?
Yeah, can I just say that if anybody's got any written thoughts, that they could send them into the Mid Welsh Joint Committee office within the next 2 weeks. That'd be really useful to get anything in writing, and some help and support in terms of Welsh language section would be really good. If we could get that into Nia's email box, that would be great, so that we can work it up. And of course, we would always be producing a plain language version of this document anyway, as a part of the process, along with a implementation plan and everything else that will go behind it, workforce plan, etc. Once we've got the high level strategic direction sorted, really.
It was just to add, it's going to our public board meeting shortly, and that will, as part of that, we'll do an easy reversion as we normally do.
Yeah, I think most organisations in Wales do that, don't they? Thank you very much, and thank you, Peter, for your hard work, and everybody else who's been involved, of course. We need to press on. It's item 7 now, strategic change programmes, and of course they don't only confine themselves to Wales. We have to look over the border as well in mid-Wales, as you all know. Hayley, do you want to mention this? There's so many of them.
Yeah,
we can't
there
possibly
is.
discuss them in detail.
No. I'd like to just thank Nia Williams for support in pulling together this report, because I think what this report always does is remind us all about how many things are happening and how complex the picture is around the strategic change programmes. I think we've covered through Peter and Steve's contributions the update around the position with Hywel Dda. So perhaps I could just mention a couple of areas really. Obviously, for Betsy Cadwallader University Health Board, they are in the process now of updating their clinical strategy, so it's very important to make sure that the Mid Wales Joint Committee are aware of this, and we play our part in participating in the process, and that's set out in the report. And also, WAST as well, the Ambulance Trust, is also at the stage where they're doing more work around their vision and what they're planning to do at a local level. And I know, unfortunately, they're not here today, but I had a discussion with WAST only this morning, before the meeting, about how they would want to engage on a Mid-Wales footing to take forward this work. I just wanted to mention, by exception then, the NHS Future Fit programme in Shrewsbury and Telford has been a key programme of work which has come to a preferred option, but just so you're aware that the process around that, it's now, there's been a referral to the Secretary of State, and an independent review panel has been established, and in fact on Wednesday this week have been called to give evidence around the independent review panel work around that. So work is still progressing because the oversight group is still taking forward work with the Trust on the outline business case development based on the preferred option, but clearly until we know the outcome of the Secretary of State review, we're awaiting that. And then I wanted to bring people's attention to the stroke position in Hereford and Worcestershire, because the All-Wales position around stroke services is something that I know a local clinician in Bronglais has led nationally, and it was just really for sightedness for people to be aware that there's a review of acute stroke services taking place in Hereford and Worcester. Perhaps people may not identify this as Mid-Wales, but certainly a large number of our patients from the Llandrannod area do use the facilities in Wye Valley Trust. So we just again wanted to make sure that as a joint committee people were cited on some of those key programmes. The rest of the report, the attachment, is basically just the very high level tracker we use in Powys to keep sort of a track really of what's happening. Yeah, by exception, Chair, if people have got any questions.
It is a fascinating appendix there, listing all the transformation and things that are happening. Oh,
I'm sure there are things missing from it.
Yes, it's quite frightening in a way. Any questions, please? If not, we're happy to receive this paper. Thank you, Hayley. And go on to agenda item 8, the subgroups updates. Steve, do you want to start with the first one?
Just to say, as I chair the PDEG meeting, the executive group meeting, I will probably seek in future just to merge the two reports, because actually we've covered a lot of what was in this report in previous reports, and it might just make it tidier on the agenda, but for now they're separate. So I won't go into any of the things we've already covered. Happy to take any questions. The only thing I wanted to raise was the area around the Rural Health and Care Wales, doing some really good work at the moment. I am in discussion with the other health boards around agreeing extension to funding. The intention of that is that I'd like to see greater alignment between the work that Rural Health and Care Wales are doing and the work that we're doing through the committee. Now, that alignment might exist. It might just be down to me being fresh to it, but I'd like to see that develop, and I'd also like the executive group to take some responsibility for ensuring that we drive that forward. So we are actively looking at that moment just to tidy up the governance. I'm looking forward to seeing what the plans will be for next year around their plans.
Right. Okay, thank you. The other subgroups is Wyn.
That's me.
He's not here. You're going to take it. Thank you.
It's me on behalf of Wyn, thanks,
yes.
Chair. Just basically to run through the Clinical Advisory Group have had sight of and have approved the delivery plan and the work programme. Mid Wales Ophthalmology plan is very much on their agenda and is forming a big part of their discussion group. Wye Valley Trust has now also joined the Clinical Advisory Group because of its connections with Powys and where we are with that, and actually in a very similar position to Bronglice at times in terms of a small district general hospital that has recruitment issues, so it's good to have them on board. That we'd received a presentation of the North Powys Wellbeing Programme, and that the Bronglice strategy has been to the Clinical Advisory Group, and the comments from the Clinical Advisory Group have come back into the version that we've seen today. Happy to take any questions.
Okay. Any questions on that? Thank you. Jack, you were going to deal with the Public and Patient Engagement and Involvement Forum.
Okay, well, we've had the events outlined in the paper, and you've seen the bullet point feedback. A lot of the stuff we pick up is health board specific, which we've referred to the health boards. But Morwenna, the point you raised earlier about the communication between came up in Tywyn a lot, and not only at a higher level with us, but Gwynedd having to talk to Bronglice, but also actually at the Aberystwyth event we had a woman came in whose father lived in Pennell, so was in Meirionydd. The doctor's surgery was Dovey Valley Surgery in Powys, and he received his oncology treatment in Bronglice, and he needed to move straight onto the palliative care pathway, and because it involved the 3 health boards, the palliative care pathway was not set up as quickly as it should have been. So that's been taken back as well. But that was purely about communication and how we get this sorted out across. So I think your suggestion that we have a group to sort that out will please the people we met there. There was also another issue raised that perhaps Ellen can sort out for us, which is everybody wants the park and ride service back on for Bronglice Hospital. That was raised actually not at the Aberystwyth event, but at the other events where people are having to travel further, and the park and ride was seen as a fantastic service. So I don't know what the possibility of looking at that is. I think the other points are there, though, but they're the ones I picked out, or the ones I've mentioned already. when the Bronglice strategy is developed and we have a more user-friendly version, I think we have to be careful that it doesn't become a patronising document.
Yes.
But people, especially who are going to use Bronglice, who live a long way away, want some idea of the care pathway and what it will actually involve. You know, because there's a certain amount of frustration if they are referred to Bronglice and then referred on to Carmarthen from various areas of Mid Wales. So we need that. If we can have a simplified version of what the care pathway looks like geographically as well as clinically, I think that would be quite helpful. And one other thing which came up a couple of times was with the drop-in centre for mental health at Corwellian and the formation of integrated care hubs across the area. People were saying, is there a possibility of having a drop-in service in the integrated hubs for just general health issues as something people could consider looking at? Because there will be lots of staff in these locations who might be able to answer questions or help people. So just to have, with the difficulty of people accessing GPs or whatever, actually, rather than rushing to A&E, can we have drop-ins at the as a part of what an integrated hub does, as something to people to look at?
Thank you. Could I ask a question, Jack? Because I know this is a public and patient forum. As with many of the other papers we've received today, there's not a huge amount of mention of the care element. I don't want anyone to think we're neglecting it's health and care, but the focus has been very much on health, hasn't it? So do you get any queries about care as well, or is it mainly health?
Yes. I mean, the thing is, certainly to simple people like me, we don't actually define the difference between the two. So when we're talking about people having problems getting home from Bronglice, people will talk to us about problems around communication. But that will be as much with the social care setup as it is with the health setup. So I think the public don't differentiate.
No, quite. I don't see why they should.
So in my feedback, being a simple man, I don't differentiate either. And luckily we have everyone sitting around the table who are much cleverer than me, who will know whether it refers to them or not.
Okay. I mean, it's just the feeling that I'm getting today. That, we care about care as well.
Absolutely. And it is fundamental to how people, will live happier and better lives.
Yes.
But it's not differentiated.
No, in the minds of the public, it certainly isn't. Oh, thank you.
Sorry, can I come?
Yeah.
In response to the park and ride, there are regular bus services going past that the car park there. I'm sure I'm not sure of the timing of them, but I'm sure they are regular. Almost as regular as the old park and ride was. So perhaps it's a perception that people don't realise that service is still there. Anyway, it's something I'll take back and see if it could be made more obvious. I agree with you, Viv, about the lack of care here. There isn't enough. And if there are comments coming through, it would be nice to see them, a little bit more detail of what people are asking about and worried about. So that helps us then to move things forward.
I mean, I know the paper we had on we have had some discussion about the North Powys development, which clearly does involve, it goes further than just care, it goes into education and housing and so on. But, sorry. Can I just Jack take the mic, Peter?
Thanks, Jack. I just I think it might be worth us opening our membership of the engagement group up to local authority colleagues should they wish to join that, Jack.
Yeah.
They are in it already, Peter. So our steering group has people from the local authorities on it anyway. So
we certainly don't want to marginalise anybody.
No.
Thank you.
No, absolutely.
Hayley,
I think Steve just mentioned about the commitment to continuous engagement. You've just gone taken through the board, and I think we all separately in our organisations have mechanisms to engage. Then we've got this engagement group as well, and I think one of the feedback points we get sometimes in meetings is, we've told you this before, or there have been several. I think one of the key issues is connecting the engagement together, which I know the group is really helpful because, you know, connecting the communication needs, but also it's about how do we gather the insights from the public or the patients and then have the you said we did kind of conversation in moving forward. It's like a building picture. And I think it's there's potential opportunities about how we get a bit more connection around how we particularly feedback. But certainly I've had feedback from the communications and engagement team locally that it's been very helpful, that those connections are being made in terms of where meetings are happening, who's going, all of that. But I was just wondering, perhaps in terms of its development journey, it's about being able to now get that intelligence together, because I'm very aware of our population and wellbeing assessments needing to be updated, and how do we get that more community softer intelligence as part of the way in which we really put forward the needs. Sorry.
Okay, thank you. Yes, Steve.
Yeah, just on that, I think you make a really good point, Hayley, because I think the other thing that I feel sometimes is the public gets a bit exhausted by us constantly asking the same questions, maybe at various different times. So there is something about how we join it together. But also I think underpinning things like continuous engagement is empowering our frontline staff to be able to make changes in the moment that they get the feedback, rather than it being something quite complicated. So for me, it's as much about how the health board changes its approach such that it allows those staff to simply deal with those things in the moment, so that things can be changed and redesigned in the moment. That's the trick we've got to get right, as well as you say, making sure we've got the kind of the intelligence feeding up in the right way, and we're not asking people the same question numerous times.
All very valid points. I think the health boards now are in a very different place to when we started, and are all engaging on a much better way with their public. So the trick for us is to do something different, and the less formal it is, the better it works. So I'm very loath to actually try and say, right, this is how we're going to do it. It's much more about people bumping into you in the street and stuff like that, and having a mechanism for feeding that in. And where these things are not health board specific, we will be replying to people about the suggestion today, for example, about the communication issues. That will be looked at by a joint group from this group. So we will be able to tell people this is what has happened as a result of what you've said to us. And we have got a database, or whatever you call it, of what all our organisations are doing on engagement. So we can see where we can piggyback on those rather than trying to do anything else formally. So we're trying to do all that stuff, but I think there is a very important issue about keeping that informality that this engagement process has always had through this organisation.
And, you know, as someone said, people are, you know, there's this sort of consultation fatigue now, isn't there? So people need to feel that they can speak when they want. Thank you. Right, and the last one was Rural Health and Care Wales Steering Group. Oh, so sorry, was there a question there, Matt?
It wasn't a question, it was just drawing attention to the list of the feedback, and thinking that people give feedback in terms of what is sort of uppermost in their mind, and they're often complaints rather than sort of celebrating anything. That's the first thing. And it is the case that they are predominantly about health services.
Yes, that's right.
And whilst I take Jack's point about not differentiating between care and health, it is significant that aspects of care are not uppermost, or they didn't come in this particular sample. And the other thing is that people haven't raised issues about well-being. And I just wonder if this comes back to, you know, the communication aspect in again of what we as a whole group of organisations are trying to promote, because the wellbeing agenda is writ large in our minds,
Yes.
but it's not clearly writ large in the public's mind, nor is that sort of relationship about taking care of your own health and working in partnership with other organisations. From this little sample,
No.
none of that features.
No, I agree. Yes.
And it would be interesting to, from forum to forum meeting, to see whether over time the list of what is uppermost in people's minds and the part that they play in the big enterprise that we're all involved in, how that changes.
Yes.
And if it does, and if it doesn't, maybe we're not really succeeding.
Okay.
I just come back on that. I think most people are very concerned with their own well-being, and most people we met felt that generally the services were trying to facilitate their well-being, but what they wish to tell us is where it's not working, which is, I think, what we'll always get. But actually, in Newtown, interestingly, a lot of the people who came to see us, who wished to talk about the North Powys Wellbeing Project, were talking about well-being, and were talking about how we make sure the environmental factors and everything are taken into account in the process. So I think it depends on what's top of their mind, but the people who came to us in Towyn, on the top of their mind was the fact that they had this communication problem, and it became apparent, that was a major issue affecting how they access services, which was the effect on their well-being. But I'm not sure you're ever going to have a consultation or engagement where people are going to come and say, well, on Wednesday I felt really happy, but Thursday was raining, so it wasn't so good. I think that we should assume that people are actually wanting to be as happy as they possibly can, and they will tell us where what we're offering is not facilitating that. I think that's as good as it's going to get, probably.
Thank you, Jack. Thank you. Right, rural health and care ways.
Right, there's a couple of papers on rural health and care Wales. So the first one is saying what we've been doing, and I'd like to take this opportunity to congratulate Anna and Harrod and Bethan on the amount of work that's going on since we've managed to appoint some staff. So thank you, one and all. I won't go through it all. You'll see in there's stuff, Ellen, about the local training issues that we're working on, which I'm sure will please you. There's a lot of stuff going on there. The one thing I would like to pull everyone back to is on page 6, which is the decision about the Rural Health Conference, Rural Health and Care Conference, which we held every year and has gone down well, and people wish it to happen again. In fact, they wish it to happen again over 2 days rather than 1 day. So you'll see in there's a proposal for the conference to be held over 2 days. Part of the reason for that was the breakout sessions. People wished to go to a lot of them, and you had to choose one of 4 the first year, one of 3 the second year. So we're going to try to reduce it to one of 2. So hopefully people will get to go to the breakout sessions over. The cost implications of running it for 2 days rather than 1 are not great at all, as you can see. So there's also a suggestion that we should charge £10 a head a day for the 1 day, 15 for 2 days to cover catering costs, if people think that would work. There is a suggestion we might look for sponsorship from national organisations as well. So there's the proposal. We would like the committee to approve it, if possible.
Yes. Yes. You've all had a chance to read this. I mean, it does involve sort of small financial issue in the charging and so on, which I think is not unreasonable at all to ask people to pay. Any comments, or are you happy to approve it? It seems a very good idea. Ellen, yes.
Diolch. Ga I just ddod mewn? A ni'n gweld fan hyn o dan pwynt 5, RHCW sits on the Regional Learning and Skills Partnership for South West and Mid Wales. Newyddion da di bod ni wedi cael arian i sefydlu partneriaeth sgiliau ar gyfer y canolbarth bydd ar ôl troed tyfu'r canolbarth, sef Powys a Cheredigion. Dwi ddim wedi dechrau to, ond mae o ar y ffordd. Diolch.
Thank you. Rosemary, yes.
We've also, within Wales, within the whole of Wales, got the Welsh Local Government Association Rural Forum.
Yes.
And they're also planning a conference for
Oh, right.
the
Okay.
autumn. So I wonder whether we should chat.
Yes,
and maybe
yeah.
each could contribute to each other's conference in some way.
Yes, thank you.
I think that might.
That's very useful,
there's
yes.
no date set yet for
No.
the actual conference.
No, thank you. That's a proper, an example of really joined up working then too. Thank you. So are you all happy to agree to this, to accept this proposal, or these proposals? It's encouraging that there's that much interest to have a two-day conference. Look forward to that. Thank you.
Well,
just hope I don't get stuck in the mud again.
It was the magnificence of one of the plenary speakers last year.
Oh, I see. Oh, well, congratulations.
We're having different ones this year.
Yeah. They will be quite good this year. They're also if anybody has suggestions at the top of the next page for a suitable person to open the conference. Chris Jones did it last year from HCIW, so any ideas gratefully received?
Well, I think we should ask Mark Drakeford. He's very keen on the whole idea, and he used to come regularly when he was health minister, didn't he, to our meetings? Yes, yes.
If you've got his ear.
Well, I wouldn't say that. He's much too busy. But I think it would be very good if he...
So we will invite Mark to...
If everyone's in agreement.
Yeah.
I think he'd be very pleased to know that we've made progress.
Yeah.
And we're still, interested.
And other suggestions there are welcome. So if anybody has them, if they send them in to Anna, I think that be good.
Thank you.
Okay.
So,
anything else on the paper?
I don't know whether we've combined 8 and 9. I think we have.
I'm going to say now as we come to number 9,
right.
And I'm going to hand over to Peter.
Okay.
Thank you, Jack. In terms of the future arrangements for Rural Health and Care Wales, as the committee will know, we have been discussing this and working through proposals for this for some considerable time now, in terms of the best place for Rural Health and Care Wales to sit, and we've explored a number of options, and at present none of those options have really come to fruition in terms of the future. So the proposal in the paper is that we continue with Rural Health and Care Wales as it is set up now for to the period of the 31st of March 2021. I have taken the liberty of writing out to funding organisations to see whether they would fund for the future. At the moment we're waiting for replies and waiting for that to come back to us. In terms of another important issue is that if we are going to have Rural Health and Care Wales sitting within the Joint Committee, it's felt that the Rural Health and Care Wales work plan needs to align to the Joint Committee work plan, which I think is fair enough. However, we have to be really careful that we don't constrain the work of Rural Health and Care Wales too much in just delivering our work plan. So I think we've got to sort of work that up over the next sort of few months, really. And that we then develop some sort of long-term plan for Rural Health and Care Wales as it goes forward into the future, and look at it what it actually is, which is Rural Health and Care Wales, not Rural Health and Care Mid Wales. So we need to start to work how we work in the Welsh element rather than the sort of Mid Wales element for the future. So the proposal in here is that we host we host under the Mid Wales Joint Committee Rural Health and Care Wales until the 31st of March 2021, pending the agreement of funding from the funding organisations and the alignment of the work plan with the Mid Wales Joint Committee work plan, if members are happy with that, and also are members happy to bring Rural Health and Care Wales into the Planning and Delivery Exec Group for the Mid Wales Joint Committee, rather than having an isolated management and steering group that is at a tangent to the Mid Wales Joint Committee, and we would recommend that it's brought into our Planning and Delivery Exec Group as the sort of host for the development work. Happy to take any questions or so.
Yes, thank you. I was going to ask about that because it's obviously broader, it's much wider than just Mid Wales.
Yes, yes.
And I couldn't quite get my head around it as to whether it was separate, whether it was different to what was originally envisaged by Marcus Longley in his report. Can anyone help me with that, please?
Well, I questioned Marcus quite a lot about what he meant in his report, and I think the true answer was he wasn't really sure what it would be. He just he said he was setting up a pile of kindling and setting fire to it and see what would happen, and this is what has happened. I think one of the things that I've found from my soundings is that it now has a name, a cachet, Rural Health and Care Wales, around Wales. So I think there was a proposal that maybe we change its name. Don't think we should do that because we have that cachet. We are being talked about in Cardiff and other places. So I think, and I think if we can be hosted for another while by the Mid Wales Joint Committee, eventually people will be able to think more strategically into the future once Brexit has happened and things, and I think a home will be found for it. That means it has its All Wales remit.
But it does have funding implications, doesn't it?
Yes.
If it's an All Wales organisation, then the funding should be related to that.
Yeah.
Hayley, do you know?
Yeah, I think a couple of things really is that it needs a bit more time, I think, to work out longer term what the right solution is. But as it is currently resourced through the Mid Wales partners, then I think it's reasonable to expect the majority of the work programme to support the Mid Wales agenda. But I think we do need to strategically move and get that sorted. So I can see that there's a tension potentially there. I just wanted to sort of mention a couple of things really. I think generally the territory around research, innovation, improvement, healthcare is very cluttered at the moment. And that's not disrespect to any partners, but there's a lot of reference to it in terms of transformation funding, in terms of integrated care funding, in terms of the broader economic regeneration, Mid Wales growth part. And I wonder whether, and I'm not trying to make things more complicated, but I am finding it hard to put my hands on how does research evaluation, or how does the whole picture fit together? And I think that, and that's not just in Mid Wales, that's an All Wales question in my mind at the moment, that probably needs a bit more discussion and development, because we've all, as part of our transformation funding requirements, probably got an evaluation piece in that. So there's an opportunity, I think there's a bit of a strategic map needed around what's happening currently. You may know the answers, I don't know. And where are the gaps and potential, particularly the gaps or the opportunities that may support people to see the ambition and the ability to move to that footprint of Wales a little clearer. So I just think in the absence of needing a bit more time and lead-up time and development discussion, be supportive of hosting it during this period of time, and in making sure that we've got a work programme that can really demonstrate the benefits and sell the idea on an always basis.
Yes, Dave.
Yeah, I agree with Hayley. We've had a couple of discussions at the executive group around this, and this is not to reflect on all the really good work that's going on. I guess the thing we're clear about in that discussion is we can't be having this discussion again in 12 months' time. No. By then, we do need to have dealt with the issues around what its role is. However, in the short term, as Peter said, it needs to be about alignment with the Joint Committee, not about it completely taking over its agenda, because there may be other things in there. So there's a bit of art in that, but my intention would be to write to the group to ask, in the light of what our priorities are for the next year, how might this group respond? What things might they be able to do? Because in the end, wherever we go in 18 months' time, if we've done some really good practical pieces of work in the short term, it just stands us in very good stead for a much wider discussion about the benefits to Wales. So it feels like the right thing to do, but we've got to make sure we don't not do it, because otherwise we'll be here in 12 months' time looking for another extension.
Yes, okay. So we are asked, unless there are any more comments, we're asked to agree a number of things. Yes, Rosemary.
Can I make a comment? And I agree with the comments that have already been made there, actually. I think, obviously, this group that's been set up should be looking at healthcare provision. That's a given. But we also should be looking at the access to services, because that's the big challenge, and all the things that follow that, like the cost of providing those services in rural areas. I've been thinking all the way through this meeting that there are so many areas where we can all work together. You know, I come from a county council background, obviously, and I've been involved in some fairly high-level discussions about unblocking roadways, road networks, and referring back to the comments that Hayley was making about all the work that we do with England, we have to do, and that provision is getting further and further away. And it strikes me that we could all help each other a lot. You know, if the healthcare case could be added to the case that we are putting to Westminster Government and to Welsh Government in terms of improving our road networks, our rail networks, all sorts of transport arrangements. And I think we need to keep that in mind, that we all we can work together, even though we may think it's not our day-to-day business. It is, it underpins what we do.
Yes, thank you. That's helpful, Rosemary. Can we look at these? I mean, the shorter term issues that we're asked to agree shouldn't present too many difficulties. If we look at the list on page 5, the end of the paper there, that the Rural Health and Care Wales organisation, whatever you want to call it, continues to reside here with this until the 31st of March 2021. Everyone happy with that? Yeah. That the 3 health boards and WAST continue to fund until 2021, March 2021 again. The name remains the same. I don't think there's any disagreement about that, is there? And then the last 2, are you happy to agree those? The aims and objectives remain, but then there needs to be some realignment. Yeah? And then finally, the long-term strategic plan, which does stretch further. Everyone agreed? Thank you very much. Thank you. Right, so brings us then to the minutes and action log in respect of the last meeting, which was held in January. First of all, matters of accuracy. Just on that front sheet there, I'm not chair of Hull University Health Board, although if I were, I would be paid a lot more money, Steve.
That post's been taken now.
Yeah. Then the minutes of the last meeting. Anything? Did anybody spot any inaccuracies? I know it's a long time since that meeting. I won't go through it in detail, but there are 13 pages. Are there any pages there? Any points of inaccuracy? If not, can we please record these as an accurate record of the minutes of the last meeting? Thank you. Then matters arising and the action log. Are there any matters arising from this which are not on the action log, first of all, that anyone would like to refer to? Yeah.
Ie, jyst mater bach mewn ffordd, ond mae cynghorydd Gareth Roberts wedi ymddiheuro tro dwytha, ond mae o wan di sefyll lawr o'r cabinet a ddim yn aelod cabinet gofal. So gwybodaeth, o'n eisiau deitha chi bod cynghorydd Dafydd Meirig yn cymryd I lefo. Felly, does ddim eisiau newid yn byd.
Okay.
Ond mewn ffordd, jyst ella swn i'n medru cofnodi diolch i Gareth, ond wedyn bysa David Meirig yn cael gwahoddiad tro nesa. Diolch yn fawr.
Okay. Thank you. That's kind. So, Nia, have you got that there? Yeah. Thanks. Right. Is that the only matter arising? Jack, yes?
I was waiting for Hayley to reappear.
Oh, right. Okay.
Because under the Rural Health and Care report last time, there were a couple of things we've been asked to look into. One was ambulance response times, and the other was, I can't remember what word I was allowed to use, but I don't think I was allowed to use bias.
Yeah.
There was an urban-rural discrepancy in waiting times for, I think the example was given orthopaedic surgery, and Hayley, you kindly said you might look into that.
Yes. Sorry. I know that Anna has developed the evidence base around this information. To be frank, we haven't quite got as far as we should have done with that piece of work. But perhaps at the next meeting, we can bring a report, an update. Is that okay? Yeah.
Okay, thank you for remembering that.
Just draw your attention, I thought it was wrong. We actually met in Dolgella last time, not in Powys.
Yeah.
Yes, of course, yes. Yeah, thank you.
Okay.
Yes?
Sorry, Viv, one more thing, which probably I should have done when I was reporting on the feedback from the public engagement, but it also comes up in this, and that's the MIU provision across Mid Wales. When we were in Tywyn, another issue that had been identified was ambulance response times in the uplands, and one of the ways they were trying to ameliorate that was taking people to the MI unit at Porthmadog instead of to one of the major hospitals. The day after that, we heard that the MIU unit in Althwen was only on for a trial time and I think it's due to finish either tomorrow or in the next couple of days. So on the principle that this organisation was set up, that any one organisation's problem is a problem shared amongst organisations, as the ambulance are seeking to improve their response times by using a minor injuries unit, can we exhort Betsy Cadwallader to extend the MAI unit in Porthmadog so that the ambulance service can continue to get their response, and also it's very popular with the local population.
Peter?
Yeah, just to say that was raised at the Planning and Delivery Executive Group, and I raised it myself, and that the Director of Planning for Betsy Cadwallader was going to go away and have a look at that and feedback to us, so we're expecting some feedback on that.
Yeah, the feedback is they're going to evaluate whether it's a success or not, but unfortunately it's due to close in 3 or 4 days' time. So are they going to extend while they evaluate? Or unfortunately, there's no one here from Betsy to answer, so it's an unfair question of the other members.
I'll take that back, Jack, and get us some feedback on it.
Right, thank you. Another matter arising, I think, was a last-minute question about Brexit and its implications. And just to reassure everybody, Welsh Government is fully aware of the difficulties that might arise as a result of a hard Brexit, no-deal Brexit. Preparations are in place, and there are regular meetings to discuss the implications for Wales. So it's just a matter that people need to be aware of. The actions, the action log, I've only got 3 items there. The first has already been actioned, as has the third. The second one, Rosemary's not here, but Hayley, can you help with that one?
Not particularly, sorry, Chair, in that I think it's tied to the discussion we've just had earlier around the future arrangements in the short term.
Yes.
I know that there have been discussions taking place, but I think we're not ready yet for that to specifically inform the position, so I can get an update for future meetings.
Okay.
I think this arose because Chris Jones had suggested this is a solution at the conference. Right. So it was being pursued, and it had been pursued in various avenues, and it had become something it wasn't.
Yeah.
So I think it's safe to say that action has been overtaken by the action we've taken today.
Right. Yeah. Okay. Thank you. And there was a Welsh language point that was made, I think, too. But really, we've dealt with it today largely. But just to say that work is being done on implementing the standards, the Welsh Language Commission standards. We're expected to comply, I know, and we're all working hard to do so, but it is difficult to meet some of the standards. We're doing our best. I think some areas better than others. Right. I think we're coming to the end of the meeting now. So we're coming to the listening to you item. And it's now, what time is it now? 1:10. So I hope we're not too far adrift. Is there any feedback or question from members of the public? Good. Do you want to...
Pnawn da, Cadeirydd. Alun Lloyd Jones o Geredigion. Dwi wedi codi'r pwnc yma yn y gorffennol. It's to do with Brexit. Dare I mention the name? I spent most of my working life in the drug industry, and one of the problems that came up when I was a member of the health board as well was generic price fixing. It seems it's going to be even more of a problem if and when things don't go properly with Brexit. Is there anything that is being done at present for the generic group of drugs? Because if there is price fixing, this is an ideal opportunity for them to hike the prices up as they've never been hiked before. And the second thing is, have we been in touch with the pharmaceutical industry? And I must declare an interest, because my pension is paid by them, to see what they are also doing to counteract this almost blackmail situation that could arise. Diolch yn fawr.
Thank you.
Shall I answer that? There is an All Wales national group on Brexit, and the health services issues and challenges are included in that discussion. And the pharmacy supply chain has also been questioned within that discussion. So there are plans being put in place for that, to cover that. But again, it's a very important point that you make in terms of the generics, because I think the generics is going to be quite a big hit if they do hike the price. So, but it is part of the national picture.
Diolch yn fawr. Can I come back very briefly?
Yes,
it's because also, as you all know far better than I, there is obviously stockpiling going on in case of emergencies, and the prices of the drugs that are being stockpiled at, and the prices eventually that the NHS will have to pay, I would estimate will be quite different. So there is that element as well, that if drug A is now put away at a penny, it could well go to the patient later on at £1.
Right.
Diolch yn fawr.
Thank you for raising that. It's a very important issue. I know there are people looking at this sort of thing all the time, and I do know that there are negotiations that go on regularly with the pharmaceutical industry, but goodness knows what will happen if we do have a no-deal Brexit. It's worrying. Thank you. Another question? Yeah.
Diolch. O'n i'n darllen gyda dy fodau y dogfen swmpus chi wedi...
Can you turn on your microphone? That's it. Thanks.
No,
yeah. The red.
By the microphone.
Where?
Silver one
on
at the base, Mark. Silver one at the very base.
Yeah.
That's it. Diolch.
Okay.
Diolch yn fawr. Nes I darllen gyda dy ddodeb dogfen swmpus chi wedi cyhoeddi am delivering excellent rural acute care gati ynglyn â ysbyty Fron Glais. A hefyd ran 13 o RHCW yn y dogfen arall. Fel ni gyd yn gwybod, mae Llywodraeth Cymru wedi datgan a gyfrwng hinsawdd. A y cwestiynau fi eisiau gofyn yw y sefyllfa am sut mae bod iechyd yn delio gyda lleihau carbon, sut mae'n ystyried y iechyd pobl yn ein cymunedau. Un enghraifft yw cyfleoedd fel COPD a sut mae llygred a carbon yn effeithio salwch fel yna ac asthma. Yn amlwg, y llygred sy'n dod allan y cybydau yn effeithio pobl yna, ac yn amlwg mae gwasanaeth iechyd yn defnyddio dipyn o cybydau sydd ddim yn cybydau a gyfrwng. Fi'n hollol deall gyda cybydau y gyfrwng y falle bydd angen defnyddio diesel am dipyn amser to, ond mae cybydau eraill sy'n cael ei defnyddio a systemau gresogi sy'n gallu rhoi dipyn o carbon fewn yr amgylchedd. A os yw y gwasanaeth iechyd fod delio gyda sgil effaith o llygred, a falle dylai gwasanaeth iechyd fod yr un cynta i delio gyda llygred mewn creu ei hunan. Hefyd fi'n cyfeirio at y tudalen 135 gyda Transport and Access, lle mae'n dweud green transport and alternatives yn y papur am ysbyty Bronglais. Un o'r pethau sy'n cysylltiedig gyda hyn yw y sefyllfa gyda pobl sy'n dioddau ynysu cymdeithasol, a bod gallu cymdeithasol yn holl bwysig. A roi dwy enghraifft o bobl yn fy ward sydd wedi taclo fi, a nes i dweud o'n i'n mynychu y cyfarfod hyn. Fi'n gwybod chi ddim yn gallu delio gyda achosion unigryw, ond rhywbeth cyffredinol sy'n gallu effeithio lot o pobl. Un dyn sydd wedi colli pwys yn ddiwetha, a naeth e dweud y fflat oedd yn byw cyn collodd ei gwys ar y llaw gwaelod o bloc o fflats, ond naeth e ddim rhagweld y cymaint o problemau fyddai'n cael gadael y fflat gyda drws i agor, drws mynd lawr y palmantiau, mynd i'r siop ac ati. A naeth e dweud wrth fi, oedd yn teimlo, unwaith oedd e wedi gadael ysbyty, oedd e ddim yn teimlo fel oedd e'n digon ystyriaeth wedi rhoi y problemau byddai'n cael. Un arall yw'r dyn sy'n fewn mobility scooter sy'n byw fewn basement fewn eiddo landlodiad yn fy ward. A naeth e dweud oherwydd oedd rhaid iddo fe mynd trwy y meddygfa cefn, oedd cael llwyni y popeth ar y lôn cefn, oedd e wedi difrodi llygad. Math problemau yn digwydd i bobl, hyd yn oed yn Aberystwyth. A beth yw'r problem yn y cefn gwlad gyda pobl dioddau ynysu cymdeithasol? A mae hyn yn rhywbeth i fi sydd yn glwm gyda sut ni'n delio gyda trefnidiaeth, gyda polisïau gwerth a lleihau carbon, achos pobl na, mae'n dioddau pob math o problemau, a hoffi gwybod, fi'n gwybod falle dwy ongl wahanol gyda'r un peth, ond hoffi gwybod beth ydych chi'n gallu wneud i delio gyda hyn. Please, diolch yn fawr.
Thank you. A number of issues there. The individual cases, perhaps you could take up separately. Would that be all right?
Yeah, absolutely.
Peter? Yeah. Thank you for raising those. But the broader issues about what we are doing, does anybody, perhaps Hayley, would like to explain what we're doing to comply with environmental proposals?
So I'll talk generally, obviously, about Powys, but obviously will apply to other health boards as well and public bodies. But Firstly, we've got the duty as part of our annual reporting to make sure that we're making progress against environmental sustainability, and there's a number of actions there. Carbon reduction is one part in terms of working and contributing towards the national plan, but also our use of utilities, power, fuel, etc. That sort of activity is part of it. Also, the Health Board is something called ISO 14001 standard. We've all been working towards and maintaining those standards in terms of that work. I think generally it's an area for development. I think that particularly when we're looking at investment and transforming services, and there's an element of physical space, buildings, there are quite formal assessments we need to take in terms of the options around, are we considering all of the green options around that, in particular something called BREEAM, which is an environment assessment, which we have to do. We have to get a certain amount of points in order to be able to get through the design process, and also there's a design champion role that looks at that, and it's supported on an all-Wales basis through shared services for the health service. I think it's an area, particularly we've had feedback in terms of the North Powys Wellbeing Programme about, are we really taking particularly the Sustainable Development Principle under the Future Generations Act as we should do, particularly looking at the long term and getting all of the generations involved in the design of that work. And also, how are we going to sort of put on a more sustainable footprint some of the access issues that we're finding. Some examples around that is we've done something around midwifery day assessment, and it's saved over I'm going to get the figures wrong, but I think it's well over 100,000 miles for patients as a result of that provision now being provided in county. So I think it's an area that's challenging for all of us. I think there's a lot of best practice, and certainly there's been a lot of push from Welsh Government in terms of some of the national benchmarking and good practice opportunities that have been put forward. But again, that might be an area we might want to, again, have a bit of a sharing of good practice across the entire public sector through this committee.
Yes, that would be interesting actually to have a, you know, an item or a conference or something. Yes. Sorry.
Chi wedi sôn am trwy y sector cyhoeddus, cydweithio, yn enwedig gyda public service boards, dysgu yn gloi o'r beth mae eraill yn neud, ac yn enwedig gan fod y Llywodraeth Cymru wedi wneud y fath datganiad, wrth nhw dweud agyfrwng, a chi'n dweud, gyda pob pach atebion positif chi wedi roi ni, ond gyda natur a gyfrwng, mae hyn yn dweud bod hyn yn agyfrwng a angen delio gyda peth yn gloi. Oes na cynllun cadarn efo chi gyda amserlen lle chi'n mynd i implemento y math o pethau sy'n mynd i trosglwyddo trafnidiaeth i efallai cerbydau hybrid neu trydan, yw fath o cynlluniau yn bodoli, neu os dim, pryd fydden nhw'n bodoli a pryd fydd yr amserlen o wneud y math pethau.
O ran Powys, allai weid, i ni just wedi cael yr ISO 14001 standard pythefnos yn ôl, fi'n credu. I don't think we reported that to board yet, Viv, but a couple of weeks ago we had that, and as part of that we had to set out our environment strategy, which sets out at a very high level the key tasks that we're going to and priorities that we're working on. In terms of detailed work programme, I think what we've got is we've got that work on an organisational level, but perhaps we're not doing it quite as well when we look at the broader system or a different geographical footprint to the Public Services Board. Because the Public Services Board, I can't remember which steps, but out of the 12 steps, there are a couple of them that are key priorities, and that has a detailed plan behind it as well. It is high level, it is very long term, but what you should expect us to see for our health boards is that we translate that into our integrated medium-term plans and the priorities. So there's a capital section that picks up the estates, the environment, in terms of our plan, which is, it's revised on an annual basis, but they are 3-year plans as well. So we could share that detail with you if you'd like. And I'm sure Betsy and Hywel and others would have similar arrangements in place.
Do you want to come in?
Yeah, it feels like it's such a huge question. We're not going to do it justice in the time that we've got here, but I think we all probably share, the view that this is something really serious for actually UK government, Welsh government, public sector, the public more generally, about how we're going to respond to this, to the climate emergency that's been declared in actually a number of places around the world now. Hayley's highlighted some of the things. I think we're all doing examples. I think I would take your point, though. Does it feel like we're responding to a crisis? I think potentially not at the moment. I think there's much more thinking to do. Some of it will be around the design of our buildings and clearly how the design of a new hospital, which is going to need to be operating in a world where we need to be at carbon neutral, zero net carbon, whatever the phrase is, in its lifetime. We've got to think about that now, how we're going to design that. But clearly beyond that as well, how we use technology, how we organise our services such that people aren't moving around unnecessarily, and we do too much of that. And actually we've seen some examples today about where we're getting better at that, and I think we need to move further on it. But it feels like we need a much bigger debate, probably with some other people around the table, to really do that justice for all of us, actually, because I think it is urgent. You also mentioned a couple of other things, if I could just pick up. I didn't want to miss the point around socialised isolation, because we do see that as a really important driver for all of our strategies, both in Mid Wales and in individual health boards, and you would have seen it playing quite a big part in our consultation process for Hywel. Cerys mentioned the transformation fund is the 11.8 million and the money going into Powys and into Betsy. Actually, a lot of that is around how do we deal with social isolation better, how do we support people much more proactively, be in contact, see how they are. And also things like housing issues, as you raise. Quite often it's not a health or even a care issue that can start the first domino falling over. It could be something else entirely. A number of us are going to see with our own eyes some of the work that's being done in Bromley by Bow, and that's about being able to walk into a place where there are housing people that can give you advice on housing, on finance, on volunteering, on a whole bunch of things. And there happens to be a GP practice in there as well, somewhere at the back. But it's actually much more about a whole range of things that people are important to people's lives. Those are the sorts of things I think will really help with some of that agenda, as well as some of this technology that I'm hoping the Transformation Fund will really help us with. So haven't got it cracked yet, but I do feel that it's at the centre of all of our thinking, actually, about how do we support a rural population in a much more proactive way than we've done in the past.
Yeah, we're all working on it, but it's not easy. It's the answer, I suppose. Yes, Ellie. Yeah.
Just dwi'n gwybod bod ti'n ymwybodol o hyn, Mark, ond ar gyfer y cofnod, mae Cyngor Sir Ceredigion wedi rhoi cynnig yn ei le, wedi cyfnogi gan y Cyngor llawn, i roi rhaglen waith i fod yn ddi-garbon erbyn 2030. Mae gyda ni eisoes wedi torri 42% yn credu ar ddefnydd carbon dros y blynyddoedd ddiweddara. A mae yna gynllun yn mynd ymlaen hyd 2023, a wedyn fydd yna un arall gobeithio yn anelu ni i fod yn neu carbon neutral o leia erbyn 2030. Diolch.
Thank you. Now, we're due to finish at 1:30, and I can see I noticed one, then later there 2, 3, or 4. So can we be succinct, please? I'm sorry, because people have to go on to another meeting.
Cynghorydd Keith Evans, byddai'n ceisio mewn myrwyr arallau. Diolch am y cyfrwydd yna. Mae dy fi un cwestiwn i'r Prifwythredwr a 2 sylw. Ydy'r Prifwythredwr yn cymryd rhan yn gwaith tyfu'r canolbarth? Dwi'n gwybod bod y gwaith yn ymwneud â'r economi yn bennaf, a mae'r 2 sir yn Powys a Ceredigion yn cydweithio'n agos. Ond byddwn ni'n meddwl bod yna rôl allweddol fawr i ddreifo'r economi hefyd yn dod o ochr iechyd. A ydych chi'n clwm gyda'r gwaith yna?
We are as a board, not me personally. I would be very welcome to come along and have a discussion about that. I think that would be something very interesting for me.
Right. Sylw arall sydd gen i wedyn, ynglyn â'r gwasanaeth allan o oriau, mae'n cwmpo mewn i'r trafodaeth gyda cleifion ag ati. Ar y lefel lleol, mae'r gwasanaeth 4 awr yr hugen gyda'r meddygon. Dwi'n mwyn gwybod eich chi'n ymwybodol, ond dwi'n clywed yn fynych iawn nawr bod dim meddygon ar gael hyd yn oed i gyfro'r elfennau yna. So felly mae yna ardalodd felly yn colli y gwasanaeth yna sy'n cael ei badjo fel triniaeth 4 awr yr hugen oherwydd bod dim meddygon ar gael. A wrth gwrs, yn gyffredinol, ond i bai bod bobl yn sôn wrthon ni, byddwn ni'n gwybod bod yna broblem yn yr isiw yna, mae yna rhywbeth sy'n bwysig i ni wneud a cael bobl i weithio ar y cyfnodau yna yw'r elfen. Yr ail elfen wedyn, eto ynghlwm, fyddwch chi'n ymwybodol o lle ni'n cael diffyg a ffwdan i recrwtio meddygon, un meddygfeidd ni, a mae un yn ward i wedi cau yn Llandysul oherwydd yna, a mae bobl wedi cael ei symud fyny i feddygfa arall. Problem dwi'n glywed eto wrth siarad y cleifion, a bydde hwn ddim yn wybodaeth cyffredinol yw bod rhywfaint o'r gwasanaethau eisoes yn bodoli bellach. Mae'r cleifion yna'n gorfod trefeili nawr i rywle fel Cyfyrddin i gael sylw a gwasanaeth partner gwaith clinigol. A wrth gwrs, unwaith maen nhw'n cyrraedd Cyfyrddin wedi, maen nhw'n ffo parcio ar y pavements ac yn y blaen, achos does dim lle i parcio, so maen nhw'n mynychu'r llefydd yna. So os ydych chi'n cael rhyw sylw ar y ddoi bwynt yna.
Okay, Steve?
Yeah, thanks for that. We were talking about GP out of hours services to start with. Yeah, we do have some real challenges in being able to staff them. I think there were probably two issues within that. One was just the problems we're having to get doctors in, and the other one I think was around communicating when we're not able to run a clinic. Are we communicating that well enough with the public? We do try to be very clear about when we can't run particular services, and Llandysul would be one of them. And I know we've had challenges. We do get those communications out. However, I would say they're quite often very much at the last minute for people, and that's something we've got to get better at. We do have some developing ideas, because we are fundamentally dealing with a lack of GPs, as a lot of areas are, and it's not limited to Hull Dar, I would say. But we are working with the ambulance service on advanced paramedic practitioners. They can do a lot of work these days to support the out-of-hour service, and we're seeing some success with that, and we're looking to roll that out further. That will help. However, it doesn't deal with the underlying challenge that we face. On the GP practice issue, I wasn't aware that the change in practice, and I know the issues there, I wasn't aware that had changed any pathways, so that people were having to go more often to Carmarthen. There may be other issues in there that we can look at. Peter's indicating, so he may have a bit more of an update than I do, but there certainly shouldn't be any expectation that generally patients would have to travel to different places as a result of GP practices changing in local areas.
If I could just come back quickly, Chair, on that. The changes in Llandysul, as you well know, are two GP practices merging together into one, and the displacement of our community teams and podiatry services, etc., that has caused the issue, and I think that's the point that you're referring to. It is our intention, and has been since we took over the Tivy surgery building under a lease arrangement, to continue to provide services from there. And we are repatriating those services back into Llandysul on a staged basis, and they are now sort of 80% there. There's still some more to go, so I do take your point, and we'll deliver those extra 20% at some point in the very near future.
I think it would be handy, Madam Chair, if you keep local members involved and aware of what is happening, because that is very helpful in stopping the blue paper being lit very often.
If I can just say, we'll drop you a note about the specifics of that, so you've got the information that you need.
Thank you. And you were next, I think.
Thank you very much. Councillor Kath Roberts-Jones, Powys County Council. Just to support what Rosemary was saying about the transport issues, it really is a really serious problem for us in Mid Wales. And although distances are quoted here, nothing is in your Bronglais document. Nothing is ever said about the type of roads that we have to travel. I mean, the A44 is the most dangerous road in Powys. I promise you, if I've got to go to hospital, I'd much rather go to Shrewsbury or Telford than I would to Bronglais on a blue light. It is really a dangerous, dangerous road. I've said this before, and I'll keep saying it until something is done about it. Because it's all very well to say, OK, yes, you can get your service in Bronglais, but it's getting there. It's for the supporters, for the relatives to get there. It's a really, really difficult place to get at. Thank you.
Thank you, Kath. Yeah, next.
My name's Lindsay Haviland. I work for the British Red Cross. My point is about definitions. At the moment in the documents, there's the integrated care centres, which seem to be co-designed with community hubs. Now, in my world, a community hub is literally that. It's a hub for the community. It's not a health and social care facility. And I would posit that it's probably far more beneficial for people to be able to go to places like men's sheds, like intergenerational luncheon clubs, whatever it might be, in one central place, and for the services to come into that place where they're already going, than it would be to set up something else. And the second one is I would welcome your definition of social prescribing. At the moment, we've got an awful lot of people who are employed as social prescribers, but what they're doing is signposting to services, and unfortunately, a lot of the services that they're being signposted to are not being funded and are therefore closing. So please can I have your definition of social prescribing?
Anyone want to deal with that? So Peter? Or... Yeah.
We're going to try and share that between us because it's quite a challenge. Just on the integrated care centre versus community hubs, I think you're right. And again, this is a whole of our reflection in all the consultation discussions we had last year. But actually, language is important about what it means, but also recognising that the world was going on whilst we were doing that conversation. So part of what you reflect back, I would say, is because we're now talking much more about community hubs, stroke networks, and less about sort of just the integrated care centres, which are about bringing our staff together. And I would agree with your point, it is much wider than just bringing staff together. It's what it means for the communities. So the Aber area on development, really welcome, particularly given the state of the hospital there and our need to do something. It's a starting point, but actually I see community networks, community hubs being much wider than just those things. And it will be about how communities come together and we help support them rather than the other way around. So we're on a bit of a journey with those things, and I think things will develop. However, I really welcome the Aber area centre. I think it's a fantastic step forward for that area. On the social prescribing thing, I think the state of knowledge around this has grown hugely over the years about what we mean by social prescribing. I think we mean much more than simply signposting people to services that may or may not be there. There is a challenge there about how we ensure that we've got the right community connectors, people who know what's going on in their local communities. I worked in Cornwall for years, and one of the feedback from Age Cornwall was that we had no idea we had a clog dancing group in Newquay just down the road from one of my health centres. It's the things that are going on that can make a difference to people's lives that we need to connect to, and actually who knows those things is really important. So for me, social prescribing, actually, and whatever we might mean by it, sits within a much wider definition of a social model for health, which is something that we are exploring, which is about how do we change from a sort of medicalised model to one where we can support the things that keep people well, keep their health being. And again, I don't think we've quite nailed it yet, but our ambition is to try and do that, is to move ourselves to a place where we're thinking much more of a social medicine system than one which is an entirely medical medicine system, if you know what I mean.
Thank you. Come and talk to the third sector. We've been social prescribing for years.
Well, when it comes to definitions, I have to say Mid-Wales has never been defined for the purposes of this committee, so it's a difficult one, yes. Thank you for those points. And gentleman here, I think it's the last question now we have time for.
Yes, thank you. Peter Morris from Newtown on the patient hospital group. Really, what I'd like to ask is how do you get on to the continuous engagement list? Because there are many things. We've proved the benefit of Newtown Hospital. Certainly kindness would be a key quality there, but there is a lack of skill. That you've got a situation where nurses can give injections, but they can't put someone on a saline drip. And there's issues of pain clinic and also the inadequate supply of GPs. They're just things we've donated to the bit of equipment to the childcare or birthing section, fetal heart monitor, and we're interested in trying to support, because as an employer in Newtown, we believe that first-class healthcare is a major part of the well-being of the area.
Yeah, quite. Thank you for that. And I don't know if Haley would like to take that one.
Yeah, thank you, Peter. I think that you raised some important points because it's about that ongoing engagement and communication. And perhaps we could speak after the meeting about how your group and how you can be more involved in that work moving forward. So
yes, I think
really
that's a good point. Thank you.
Thank you.
Hi, Peter. I know you've come to several of our meetings, so I hope you're on our list, and you get pestered by us quite often. And I believe the fetal heart monitoring is part of the telehealth project that is one of the priorities in the work
plan. Very important. Yeah. Thank you. I just have, just before we finish, one point to make under the listening to you item last time this group met. There was a query about eye care by a resident saying that there are no consultant ophthalmologists at Ysbyty Gwynedd, and I'm told that that is not correct, that there are in fact 4. So I don't know quite where that came from, but I'm just putting the record straight. I'm not sure quite what that was all about.
We were in Dolgellau last
yes,
time.
I know, yes. Thank you all. Diolch yn fawr for attending today. It's been a good opportunity for me to meet some of you, not as well attended as other meetings of the committee that I've attended, but perhaps next time in Gwynedd it will be better attended. The next meeting is on the 25th of November in the council chamber in Dolgellau. So I look forward to that, and we will be around to chat with anyone who'd like to speak to us now for about half an hour. Thank you very much indeed, everyone. That concludes the meeting.